When you saw Dawson, what condition was he in?
I knew he was gone.
Patrick Clancy's 3 children were strangled to death. The person who admits doing it is his now ex-wife, Lindsay Clancy. But Lindsay says she's not criminally responsible because of her mental illness and her lack of proper medical treatment. Lindsay's psychiatrist is back on the witness stand defending her treatment as she was being grilled on cross-examination by Lindsay's attorney.
Why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So the question for this jury is whether Lindsay's condition and lack of proper treatment is the reason that she killed her 3 children.
But you increased the amitriptyline.
Yes.
And that pushed you over the edge, didn't it?
I don't think so.
Lindsay is on trial facing 3 counts of murder in the trial that has captivated the nation. This is the biggest day yet in the trial of Lindsay Clancy, as the defense is pointing the finger directly at Dr. Jennifer Tufts. Her credibility could be the difference between life in prison and some time in a facility for her mental illness. Everything is at stake. I'm Vinnie Politan. Let's investigate. I've been saying it from the beginning, and now you're starting to see it in action. Lindsay Clancy's defense attorney, Kevin Reddington, is one of the best. And one of the best we've seen through my entire career here at Court TV. And I've been here a long time. I've seen a lot. But what I know is part of this comes from who he is, but it's also his experience. And he has a lot of experience. He's very seasoned. I mean, just on Court TV, I've been seeing him over the course of decades now doing what he does very effectively. And this is a case where he is going to cross-examine Dr. Jennifer Tufts, who is a young psychiatrist. So this is someone who's sort of at the beginning of her career in her profession versus a guy who's been doing this a long, long time. And some might think it's not really a fair match. But I think the jury will understand her inexperience versus his vast experience. But the question is, how much do they hold it against her, or do they feel sorry for her if he ends up beating her up just a little too much because of his vast experience? Now, for Lindsay Clancy, what she has to overcome in this entire case is that she has 3 dead children, and she's the one who did it. And you're asking this jury to find you not criminally responsible. So it comes down to really a question of who's to blame here. Who is the jury going to blame? Are they going to blame Lindsay Clancy, the one who actually did it, or her treating psychiatrist, Dr. Jennifer Tufts, who perhaps misdiagnosed, gave her the wrong medication, gave her too much, was in over her head, whatever it is, the defense wants to point the finger at her. So let's start taking a look at that cross-examination, crucial part of this case. And here you're going to see how Kevin Reddington goes after her inexperience.
When was it that you actually started working as a physician, as a psychiatrist?
I started working as a physician and as a psychiatrist during the residency training program, but I started practicing completely independently at Astor Mental Health in August of 2022.
Now, in August of 22, when you, congratulations, obviously you were hired by Astor, how many women had you treated in your residency that were postpartum?
With postpartum depression? Or just in the postpartum period?
How many women that were in the postpartum period did you treat prior to August of 22 in that population? And where did you have the training in that population?
At Boston Medical Center.
And can you tell us in that 2-year period approximately how many that were in the postpartum period that you treated as a resident?
Okay, so it's really hard to give an exact number, but if I had to say, at least 50.
So in the 2-year period, you treated 50 people in the residency that had postpartum. And can you tell me, what is postpartum? What does that mean?
Well, I just want to address that it was
Okay. So
And sorry, what was
saw
your question?
Hold on. You saw 50 people in a 4-year period that had postpartum. In other words, they had been after having a baby, right?
Possibly, yeah, more or less. I saw a number of other patients. I saw much more than 50, but yes.
So after you had your residency and after you were hired by Astor, is that when you began in August of 22 your practice as a practicing psychiatrist?
Yes.
And when was it that you actually got your DEA license that authorizes you to prescribe medication to citizens?
So during residency, I had a DEA license, but it was affiliated with the with Boston Medical Center. And then when I started at Astor, I had my own DEA number. I don't know exactly when, maybe sometime around August.
So August of 22, you start working at Astor. August of 22, you got your DEA license individually that authorized you to prescribe medication, correct?
Yes.
And it was when that you saw Lindsay Clancy?
I believe our first visit was September 15th
Of
2022.
So you were practicing as a psychiatrist for a little more than a month.
I was practicing independently with my full credentials for about a month, but the training is just immense. That goes on before that.
Absolutely, it must be. But that's a residency that you're talking about, right?
Yes.
And you know, in a residency, I mean, all I know is grades.
This is a big point. 1 month on her own. 1 month on her own, and Lindsay Clancy is her patient. Big point for the defense. Doesn't mean that she didn't know what she was doing, but everyone knows, like, the more experience you get, the better you get at what you're doing. And she's been doing it on her own now for just a month. You take that, plus the fact that she still looks so young, like looks younger than she actually is. All of that, I think, will help the defense with their theory of who's to blame in this case. Let's continue.
Anatomy, but I mean, you're working under a doctor, the doctors are supervising you, and they tell you what to do, and then you report to them, correct?
They don't really tell you what to do. There's a resource if you need additional support, but I followed many of my own patients. I was the only person in the room with them, and my notes were signed off by an attending physician, and that attending was available for any support I needed.
So in August of 22, when you started working at Astor, you actually filled out a form for your advertising. Is that correct?
I believe that was handled by other people at the practice.
And who would that be?
Well, we have non-clinical staff that handle the administrative matters.
Okay, but you're a doctor, and you're out there to the public. You're advertising yourself and your services to the public. Is that fair?
I believe, yes. I'm not directing the marketing of our office, but yes.
Okay, never mind your office. I'm talking about you. You had an ad that was on the computer that if somebody wanted to reach out to a doctor, they could see your ad amongst many others, right?
Well, I don't think there was an ad. I think we have a website that has some information about myself.
Okay. Now, in August of 22, up until when you saw Lindsay, how many patients in that month or so had you treated for postpartum psychosis?
How many patients in a month up until then?
Yeah, I'm asking you about when you started working in August of 22 for Astor. You are now on your own as an employee. How many patients had you treated before you saw Lindsay Clancy for postpartum psychosis?
Well, in the span of 1 month, I would say none because it's a very rare disorder.
Yeah, okay. But it exists, doesn't it?
Absolutely.
And one of the things would be the voices that people hear, right?
That is a symptom of psychosis, absolutely.
And that's legitimate, isn't it?
It is a legitimate diagnosis.
No, not the diagnosis. People that have postpartum psychosis here leases, do they not?
Many do. The disorder can manifest differently in different people, but yes, many people do hear voices.
How about postpartum depression? How many people in that month or so before you met Lindsay did you treat for postpartum depression?
In the span of 1 month, it's really hard to pinpoint that. Maybe a couple.
Maybe a couple? And do you recall how long you treated them for?
Again, it's hard to really pin down the individuals in a short span of time.
Can you tell the jury what you put in your ad or in the Astor website that you indicated that described you?
I don't recall.
Well, one of the things you did is that you said that you basically were a specialist in postpartum, people that have postpartum psychiatry. You indicated that on your website, didn't you?
Are you able to read the actual document? I don't remember exactly the wording.
Well, you've been working now for how many years now? 3 since you saw Lindsay? Or more?
Almost 4, yes.
You haven't changed your ad on the website, have you?
I have not personally, no.
And you've read it probably a bunch of times, right?
I've read it a couple times, but I don't spend a lot of time on my website.
Okay. Do you recall that you indicated that you were specializing in any particular aspect of psychiatry?
Yes. It probably includes a special interest in women's health, in perinatal psychiatry, in trauma-related disorders, anxiety, and there may be some other things that were mentioned.
Yeah, like women that have babies and they're suffering from postpartum depression, right?
Absolutely.
You advertised that after a month in working for Astor, right?
That's listed as one of my interests, definitely.
And again, forgive me, how many women did you treat for postpartum depression in that month and a half before you met Lindsay?
I don't know, maybe a couple. But I've treated many of them in the residency, which was just immediately before.
So when a person needs to see a psychiatrist, generally they're not well. Is that fair?
Some are not well. It really can vary.
So when someone comes to see a psychiatrist like you, it's because they need help, right?
Yes.
And when they come to you because they need help, for example, with Lindsay Clancy, she came to you because of your ad, right? Or your website for Astor, what you said about yourself.
I don't know exactly how she found us.
Well, do you know why she came to see you?
I'm not sure exactly.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they are.
Yes.
And you know that Lindsay was a nurse, correct?
Yes.
You know that she graduated, obviously, from college, right?
Yes.
She a good student?
I don't recall.
Do you know when she got married?
I don't recall.
Did you ask her?
Detail. I don't know. I knew she was married.
She had 3 kids, right?
Yes.
And the reason that you knew that she was married is because you spoke to her husband, Patrick, correct? Or did you?
Sorry?
Or did you?
He attended one of the appointments, and I spoke with him on that day.
And did you say, hi, how are you? Did you give a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say that after, what is it, 14, you said to the jury, 14 appointments that you had with Lindsay during that period from September till January? 14 appointments?
Yes.
Every single one of them were by telemedicine, weren't they?
Yes.
And until you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
Were you ever concerned about her mental?
This is classic, right? This is a point that could be spun for either side in this case. Lindsay, on the one hand, you can say, chose to do telemedicine versus a doctor who chose not to see her actual patient. So a good attorney will make either answer sound wrong. And right now, Kevin Reddington's doing that to Dr. Tufts. 14 appointments? And the first time you saw her is inside this courtroom? Makes it sound like it's outrageous. The prosecution could do the same thing. You're getting medicine from this doctor 14 times, Lindsay, and never once did you go to the office to see the doctor? Difference is, Lindsay's probably not going to testify. Let's watch.
As a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time she said it was difficult to get out of bed.
Oh, difficult to get out of bed. Why was it difficult for Lindsay Clancy to get out of bed?
She was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
I imagine. Now I'm looking at you, and you've got the witness here cutting you off in half, right? So I can't see from your waist down, your legs, your feet, your hands, anything. That's the same view that you have on the telemedicine, right?
Yes.
Isn't it fair to say that you've studied and that you've learned that there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
Yes.
Like hand wringing, right?
Yes.
Were you able to see the hands wringing when you were on telemedicine?
I don't recall seeing her hands.
You recall, you know how people sit there and they do this with their leg and their leg bounces because they're going through some type of emotional stress? You couldn't even see her legs, could you?
I couldn't see her legs, but I knew that she was under stress.
So, September 15th, I believe, is the first time that you all actually discussed her condition, correct?
Yes.
And looking at the medical records, which you will be able to look at, it says visit date September 15th, 2022, and you can look along with me if you wish. Indicates why she came to see you, right? Right? Yes?
Yes.
Okay. Why did she come to see you? According, not guessing and speculating, never mind the TV. You just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
So what you're seeing here, and it's coming through, right? It took a little while. He warmed up, and now Kevin Reddington is going after her. He's not screaming at her, but he's going after her. And now you can see from her, she's realizing, oh boy, this is the way it's going to go. And folks, this is just the beginning. This is just the beginning. Another crucial part of Dr. Tufts' testimony is about the medications and what she was prescribing and why she was prescribing it and what these medications could help or could hurt Lindsay Clancy. Big part of the defense is premised upon the medications, the over-medication, the wrong medications. So let's take you back inside the courtroom now as Kevin Reddington, again, cross-examining Dr. Tufts about the medicine that she was prescribing for Lindsay.
So the only thing that you diagnosed Lindsay with on September 15th was GAD, Generalized Anxiety Disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with Judy's food.
And you prescribed medications to her, right?
Yes.
And the medication that you provided to her was the Sertraline, right? sertraline would be Zoloft, right?
Yes.
Now, this is a little chart that shows the prescriptions that Lindsay was on. And you are the yellow colors. Okay. You can see that. Do you agree with me that on September 15th you prescribed sertraline, Zoloft, 30 count on September 15th, 25 milligrams, right?
Yes.
Have you ever read the website for sertraline?
The website for sertraline?
Yeah. I mean, sertraline, Zoloft, is a chemical that is marketed as a pharmaceutical, right? Right? It's a pill, right?
Yes.
And as we said, it's an SSRI pill, correct?
Yes.
Do you know that Zoloft is not indicated for generalized anxiety? Why'd you give her Zoloft?
It's a very effective medication for generalized anxiety disorder.
So you're familiar with the drug labeling for Zoloft, is that correct? Generally. Are you aware of what the manufacturer of Zoloft indicates it can be used for, to treat?
Aware that it's used to treat various forms of anxiety disorders as well as major depression.
With that information, you then prescribed Zoloft to her, correct?
Yes.
You went over the side effects of Zoloft, sertraline, I imagine, with her, right?
Yes.
Did you tell her that one of the known side effects is suicidal thoughts and actions and ideation?
Well, that's specifically in children, so I don't think I mentioned that.
Well, not really. Suicidal ideation and homicidal ideation. There's a black box warning on Zoloft, along with the SSRIs, right?
Under
Yes or no?
for children and adults younger than
Excuse me, I apologize. Can you just listen to my question and answer this? Is there a black box warning on Zoloft?
Yes.
And a black box warning is required or prescribed by what? The FDA?
Probably.
Probably. And it basically warns that, especially with young people or young adults, that it may cause suicidal or, God forbid, homicidal ideation. Yes?
Yes.
And you're aware that, in fact, the FDA has determined that that goes up possibly to a 23, 24, 25-year-old. You know that, right?
I think 24 is what they said.
24. It's possible, is it not, that the SSRIs that get into a person's brain affect a person that's 3 or 4 years older than the FDA cutoff with suicidal ideation or homicidal ideation? It's possible?
There's a lot of development that happens in the brain between ages like up to 24 and closer to 30. The brain is fully matured at past age 24, and so it's less vulnerable than any younger individual.
So with 24, you're suggesting as a cutoff, are you suggesting to the jury that a drug that increases the risk of suicide in a 24-year-old patient cannot increase the risk of suicide in a 29 or a 30-year-old patient? Just a little bit.
I don't believe there's evidence that it causes that at all in individuals over 24.
So, as a psychiatrist who had the ability to issue these types of medications to patients and citizens, what research did you do on Zoloft and suicidal ideation, homicidal ideation?
I was taught extensively about SSRIs and suicidal ideation.
That's actually wrong, right? So in Vermont was when you get your medical degree, right?
Yes.
And in Boston would be when you were a resident, right?
Yes.
And then you had board certification on general psychiatry, right?
Yes.
You can have a certification on a subspecialty, right?
There are some subspecialties, yes.
Right, and some of the subspecialties deal with postpartum or women that are pregnant and have babies and have psychiatric symptomology.
There's no board certification for perinatal or reproductive psychiatry.
Well, there are plenty of classes that are recognized as, for example, at Harvard Medical School, there's an annual class or symposium, if you will, for postpartum. Have you ever been to that?
Yes, sir.
What have you done to research or to improve your education? I understand you went to med school and that you were a resident. What programs, continuing education, symposiums have you attended since you got the ability to prescribe these medicines to people?
I have not attended a symposium.
Have you attended anything?
I have not, but I have done a lot of reading on my own, of research and guidelines about this area in psychiatry.
Did you tell Lindsay when you were going, because one of the things that you guys are always concerned about is what's called informed consent, right?
Yes.
And what is informed consent? What does that mean? In a medical sense, not just like out in the street or something.
Explaining to a patient the risks and benefits of treatment and possible alternatives, and making sure that the patient understands what you're saying.
Now, when you were going over the symptomology or when you were going over the side effects of Zoloft, one of the side effects of Zoloft is, and I quote, severe trouble sleeping, right?
Yes.
Did you tell her that?
Well, insomnia is listed as a side effect.
No. You already said yes, you know it. Did you tell her that Zoloft has a side effect of giving the patient severe trouble sleeping? That's all.
So I didn't use the word severe because it typically doesn't cause severe trouble sleeping, but I thought you were referring to when she told me that she did have severe trouble sleeping.
Well, that's what she told you, right? That she had severe trouble sleeping, right?
She told me.
Yes. And you know that one of the side effects of Zoloft is, let's say, trouble sleeping. You know that, right? Your answer is yes. The jury has to be able to hear you.
Yes.
And why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So individuals have very varied responses to medications. Some have no side effects, some have one or two. It's impossible to predict, but Zoloft is a top choice, a first-line medication.
Says who? Says who?
Says it's the general consensus.
Right, you know about the lawsuits against Zoloft, right?
Yeah, you can't have both of you talking at the same time. So let her finish her answer, and then I'll give you plenty of time to follow up any questions regarding her answer. So.
Sounds to me like Kevin Reddington is setting this testimony up for what his expert will say when it's the time for the defense to present their case. Suicide and the alleged suicide attempt by Lindsay Clancy has been a big issue throughout this case. It's not 100% clear where prosecutors are on this. They seem to have backtracked from saying this was a faked attempt by Lindsay Clancy to something sort of in between. I don't really understand it. But here, Kevin Reddington is now going to ask Dr. Tufts, the treating physician, about Lindsay Clancy and her prior suicidal thoughts. Let's take a listen.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
It's kind of like being a fisherman out in the ocean who's worried about the possibility of a storm and is thinking about the storm and is dwelling on the storm, almost in fear of the storm, right? Isn't it? So when she tells you that she's, and I don't want to put words in your mouth, what did she say? She's having suicidal thoughts, or what did she say? All close to it?
She denied having suicidal thoughts, but felt that she was getting close to it.
Okay. So she was dwelling on it or thinking about it, right? Is that fair?
She was fearful of eventually having those kinds of thoughts.
To kill herself.
Yes.
And how frequently were the thoughts?
I'm not sure exactly how frequent they were.
Did you ask her?
It's
Sorry?
very likely that I did ask her the frequency.
Wouldn't that be in your medical records? When you see some patients, you have some patients other than Lindsay Clancy at that point, right?
Yes.
And you document when a patient, my God, when a patient comes in and tells you that she's in postpartum distress and she's close to having suicide thoughts to kill herself, that's important, isn't it?
It's important that I am aware that she's having these thoughts.
What thoughts?
That she is fearful she could become suicidal.
And she told you, I imagine, when you asked, how frequently these thoughts were.
I don't have it documented how frequently they were, but that is a question that I usually ask when we're talking about suicide.
So when we're usually testifying in a murder case, we usually have facts that we can tell the jury, not speculation.
Objection.
Did she tell you when you asked about suicidal thoughts?
Yes.
What did she tell you? If you don't know, tell us.
No, I know, sorry, but it's what I said before, that she denied having them, and she wasn't having them, we were meeting, but she felt close to it, close to having those thoughts.
Okay. So would you agree with me that many times patients, especially psychiatric patients, may minimize their symptomology?
Patients sometimes do.
And sometimes when a woman has just had a child and has other little kids at home, you're worried about the government taking kids away from them. Because you're a mandated reporter, right?
Yes.
You're a mandated reporter, right?
I am.
And if she told you, I'm having suicidal thoughts, I'm close to it, and homicidal thoughts, you'd report that, wouldn't you?
Not necessarily. I think it really depends on the context, but having suicidal thoughts alone is not a reportable condition.
As we pointed out, you tell the people that come to see you, when I say you, I mean collectively Astor Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right? Look up the number.
We advise them to call 911 or go to the emergency room as quickly as possible.
How about suicide hotline? You give them advice? Call
That's an option as well.
Did she call suicide hotline?
I was not aware that she did.
Did you ever ask that?
I don't think I specifically asked that
How about
question.
non-specifically? Did you ask her anything? Did you beat around the bush maybe? You asked her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were in the front line, right?
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
Again, Kevin Reddington making everything that she does sound like it's wrong. But you could turn this around as a prosecutor. You never told your doctor. You didn't tell your doctor that you called the suicide hotline twice? Like, where does the information that the doctor gets? It comes from the patient. Does the patient give the information or not give the information? Do they have to be asked or do they volunteer it? Both sides can spin it their own way. This next part of the cross-examination of Lindsay Clancy's treating physician, so important, so significant. We're talking about January now of 2023 up until January 23rd of 2023, the day before those 3 children were killed by Lindsay. So let's go in and carefully watch this cross-examination.
How about on January 9th? Did you see her through the computer or whatever then? And did you prescribe medication to her on that date?
Yes.
And was that diazepam?
Yes.
14 count, 1 milligram? No, I'm sorry. 14 count, 5 milligram.
That sounds right.
Okay. Did you also, on January 12th, 3 days after January 9th meeting, prescribe additional medication to her?
I'm not sure. I don't have a record from January 12th.
Do you recall on January 12th that, in fact, you prescribed trazodone 150 milligrams, 30 count?
Yes.
3 days later, or a couple of days later, January 16th, do you recall prescribing amitriptyline?
Yes.
What is amitriptyline?
Tricyclic antidepressant.
What does a tricyclic antidepressant mean?
Well, it's an older antidepressant. It's called a tricyclic because it has 3 rings. If you look at the chemical itself, like a tricycle. But it's an older but efficacious medicine for depression and anxiety as well as insomnia.
On January 16th, look at your interval history. She indicated to you that her mood was very low, no motivation,
Yes.
numb,
Yes.
able to force herself out of bed, taking care of basics, eating, concentration fine, caring for baby, bonding feels forced. Is that what she told you?
Yes.
Through the computer, right? What did that tell you? Were you concerned about this woman postpartum well within the year from the CDC at that point with these symptoms that she's telling you about?
I was concerned that she's depressed.
And in all of the times that you spoke to her, you'd agree with me that she appeared to be honest and forthright, telling you what she felt, right?
That's what I thought she was, yes.
Do you have any reason to think that she was lying to you?
No.
Diazepam taper on January 16th, 5 milligrams last 2 nights, slept for 4 hours, and then a light sleep, maybe 2 hours stretches. Did she express that she was still having concerns about side effects from medications?
Not at that point.
So what does ROS mean under interval history that we're looking at?
A few of symptoms.
Okay. And then it says patient denies SIHI, that would be suicidal ideation, amitriptyline for depression, correct?
Yes.
Patient agrees with the treatment, and you guys were also going to explore ketamine treatment, esketamine.
Yes.
Now, did you know that she was on her computer looking up medication after medication after medication after medication, and treatments, ketamine treatments, and all that? Did you know that? Did you ever ask her whether or not she was looking up the symptomology of pharmacology and having interactions between drugs?
No.
January 23rd, you had that meeting, correct, with her? And this is after, obviously, excuse me, the January 16th appointment. And in the January 16th appointment, she told you that her mood was very low, and that's the worst that she ever reported her mood to you. Isn't that right?
On the 16th?
Yeah.
I don't know if that was the worst it was ever reported, but it was certainly bad.
And you didn't recommend that she have a hospital evaluation, did you? This is the day before she killed the kids, right?
The 23rd?
Yeah.
Was the day before.
You didn't recommend a hospital evaluation, did you?
No, there were no...
The answer is no?
No.
They'll ask you all the questions they want. Your answer is no. January 23rd, Friday, you testified that she said her mood was depressed, and you noted that her affect was depressed and flat, right?
Yes.
She also reported that her heart was racing, right?
Yes.
She had no motivation, is what she told you, right?
Yes.
She told you that she had been feeling, numb and no emotion for 17 days straight, is what she told you, right?
I'm not sure about 17 days straight, but that's how she was feeling.
You didn't reach out to her mother and father at that point? They didn't call you, I guess, right?
No.
And Patrick didn't call you at that point, right?
No.
So she's sitting in front of her computer getting help from her doctor on January 23rd. And what did you do?
I thought about how I could best help her, the medicines that she tried and what her current symptoms were. And it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
But you increased the amitriptyline.
Yes.
And that pushed her over the edge, didn't it?
I don't think so.
Wow. You increased the dose the day before, and that pushed her over the edge. That is the defense pointing the finger directly at this doctor and, of course, the impact that the medication's having on her. If the jury believes that, she's not criminally responsible. Still got a long way to go, though. That's it for now. Thank you so much for watching. I'm Vinnie Politan. In the meantime, please don't forget to hug the kids.
Before we get going, I just kind of wanted to remind everybody that there is a media order that has been issued on this case. And for some of the media and the individuals who've been here for the last couple of weeks, I'm sure are familiar with it. But I know there's a constant people coming in and out. So I just want to remind everyone that there is a specific media order that's been issued on this case. And everybody is presumed to have reviewed it and agreed to it. So if there are any violations or problems with that, we'll have to deal with it. But I just kind of wanted to remind everybody, especially people who may have just come into the courtroom recently. So if you have any questions about what that order is, you can speak to any of the court officers. They have a copy of it. We can get a copy of it to everybody who needs to see it and review it. All right, and with that, what we'll do is we're going to go, the defendant, had filed a motion for addition to the witness list, to add to the witness list regarding Ms. Thorndike. So what I'm going to do first, I'll hear from the defendant, then I'll hear from the Commonwealth.
Thank you.
Mr. Reddington.
Thank you. Your Honor, basically, as the motion speaks for itself, there is a woman, her name is Emily Thorndike, who's a LACSW here in Massachusetts. She owns and is an independent operator of her own clinical social work establishment called Wise Mind Therapy. Your Honor has her resume. She graduated from Dover Sherburne High School, received a Bachelor of Arts in Sociology from Hartwick College, master's degree from BC, 2019, is licensed in Massachusetts. And interestingly enough, she did work at the McLean Hospital in the very short-term unit that the doctor was testifying that Lindsay was in for 5 days in January of 22 into 23. She worked for 5 years as a mental health specialist from May of 2014 to May of 2019. She was a clinical social worker manager of that unit from 2019-2021. So she's basically got about 7 years and 7 months of experience working in that unit for a majority of that period of time, full-time employee, and then for 1 year as a supervisor. She left, as the court is aware from the motion. I vetted her out. I obviously would be concerned if there's any so-called axe to grind, if you will, any lawsuits pending. Were you fired? Did you have any difficulties? Any claims for harassment, hostile workplace? Absolutely nothing. She has friends that are still employees that still work at McLean. And I do not know this woman. I have literally never met her. Her involvement in this case came about after one of the prosecutors, I don't recall which, made it out on direct examination that McLean is some kind of a five-star institution where the doctors, the psychiatrists, the psychotherapists, the counselors were all banging into each other in the hallway trying to interview Ms. Clancy, who was just blithely refusing care and treatment, which is not the case. Patrick testified as to his observations. The court is aware that Patrick's testimony clearly in all fours landed on the fact that it was clear to him that there was no staff that was available other than kids behind plexiglass on their cell phones. She colored. She took walks. There was no therapy. She didn't speak to any therapists or counselors. So now the jury is left with that image that McLean is purportedly some kind of a five-star hospital because they're affiliated, quote unquote, with Harvard, which you from your practice, I'm sure, as I know from my practice, is as far from the truth as can be possible, in my opinion. But it doesn't matter what my opinion is. I could cross-examine somebody till the cows come home. It doesn't matter. This woman posted a video on TikTok, which, much like yourself, I'm sure, I hardly know what TikTok is, but I received an email from one of the very, very active people in the community of TikTok saying, look, you got to check this video out. So I did. This is about a week ago, maybe longer now. When I saw her video saying that she could not stand for, and I quote, the lies and the misrepresentations from that witness stand about McLean Hospital, I then said to my private investigator, Bob Jones, I said, Bob, I can't find this woman because she had a pseudonym name or whatever. He went, we wrote, he called her, left messages. She never got back to us for like 3 days. He went to her house. He sat out in front of her driveway. She came home from work. They interacted. He waved, didn't want to scare her. And she said, I thought, and oh, by the way, I believe that my wife had written her a letter as well because she's a nurse and was trying to reach out to her to have her get in touch with me, to no response. She then tells Bob, I thought you guys were all AI. I didn't know that you were real. I thought it was spam. He then gave me her number. I spoke to her. She told me exactly what I put in the affidavit or in the motion. And she is available, ready, willing, and able to testify to an employee's observations over 7 years, including as a supervisor, as to what woeful environment McLean Hospital offers, especially on holidays such as major holidays like New Year's, which is fine. We all enjoy New Year's. But nevertheless, New Year's, the day after, that weekend, Monday, nobody was there. And I think it's important to rebut the inference that was created through the examination by the DA.
All right, Mr. Brake, let me ask you this, and I'm going to ask the Commonwealth kind of the same thing. What's the relevance? What's the argument for the relevance of what McLean's was, at least because she wasn't there for about a year, if I looked at the motion. Is that correct? No, that's all right.
Yeah, that's true. She left. She has her own business now, and she left, but it was just a year.
Yeah.
There's no change in the circumstances from Lindsay going into that hospital on New Year's of 2022 to 23, and this woman's work experience where she left a year before. And I agree with you. This would have been a non-issue were it not for the flavor of the government's repeated argument that she was a person who was spurning health care, didn't want health care, had the opportunity, and she walked away from the opportunity, which, as I say, is as far from the truth as possible. So I think it is now, because of their questioning, squarely before the jury, to leave that impression. And the woman that was the doctor from McLean was just a pleasure. She was just a lovely, lovely woman and testified as best she could on the case. But they're left with the impression that McLean is this wonderful place that she just did not have any interest in utilizing what was available to her. That was not available to her. And she's testifying to custom, practice, and her observations over 7.5 years.
Is there another alternative to get there? Someone who actually works there or worked there during this time period? That it's the time period that
a year?
One of the things that, well, yeah, but things can change in a year, you know?
I don't think so at McLean.
I don't know so. I guess that's the question. I don't know so. That would be, that's one of the things I may have to wrestle with, but that's kind of what I was asking, whether or not there is, or I understand the argument.
Okay.
And I understand the argument regarding relevance, but if we're talking about staffing or the availability of programs and how that work, this witness is a gap there. I guess that's all. I'm wondering if there's another way to get there.
So, you know, the realities of trial practice, if you're the government, you send summonses, you have people come to your office, you're interviewing witnesses. If you're the defense, they run for the hills. For example, one motion I'm bringing with you is merely looking for pediatric records that I have had to have Bob Jones go and try to get them, HIPAA forms, everything, and they're avoiding us horribly. And I'm going to have a contempt hearing request very shortly. But the point I'm getting at is, if they want to reach out to McLean, I'm sure that McLean administration would bend over backwards to give them every record that they would need as to how many employees they had, what their work records were, their doctors, their counselors, all available. I know I can't get it. So I'm suggesting to Your Honor that this is an opportunity for a person who worked there for all those years who does not have any dog in the fight to testify to what her observations were clearly within her time frame. She left a year before Lindsay went in there on New Year's. So I certainly agree with that. Cross-examination, they could get records if they wish, but I think it is relevant. I think it's material, and I think it has to be used to rebut the inference that was raised.
All right. Thank you.
Thank you, Judge.
Yeah, Commonwealth?
Your Honor, the Commonwealth would object to the witness, the late disclosed witness, in addition to the obvious Rule 14 issues, the fact that we didn't have notice of this individual, there's been no discovery other than what's contained in the affidavit, and what we could identify from this woman's TikTok video. There's no report from the investigator who, admittedly, by counsel, has spoken to this witness, this individual. Aside from that, we have a number of other issues with this witness. One is this isn't somebody that's proposed to be an expert, so they're not relieved, they wouldn't be relieved of a sequestration order. But this woman's TikTok, admittedly, she's been following the trial. She goes on for several minutes in a very long TikTok video where she identifies what she thinks are lies based on her observations of Patrick Clancy's testimony. We have no idea what her thoughts are or what her comments are on the rest of the trial that we assume she's watched based on her comments in this particular video. that she outlines in this video her experiences at McLean and her observations and how they are different from what was portrayed in that particular witness's testimony. But in the course of this trial, we not only have that particular witness's testimony, we have records from McLean, and the records speak for themselves about what she was offered, what she did, what she declined, what the contact was with each and every person who wrote a note in that record. But this witness admittedly wasn't there, had no contact, has no knowledge of the case in of itself. And in this case, Your Honor, we deal with facts. We're presenting facts to the jury. We're not presenting somebody's opinion about what kind of care the defendant got during her stay at McLean. That's not what this trial is about. That's not what it should be about. And if it wants to play out in the court of public opinion, that's fine, but not inside the walls of these courtroom. So this person who said that she cares about Lindsay in this video, whether other people do or don't, this person who said that the prosecution of this case is an abomination, this person who said that the health profession needs to be held responsible for their care of the defendant, that's not a witness that presents facts to this jury. And I would also agree that there is a problem with what relevant testimony that she could give. There is no indication that what her experiences were in those 7 years up until December of 2021 are exactly the same as they would have been when the defendant was at that short-term unit at McLean. And the defense had the opportunity to ask that of Dr. Goodhart, and he didn't. So there is...
Wait a minute. I think she said, I don't know what the staffing was. Didn't she say, I don't know how many people were on? I don't know if it was a skeleton crew?
She said on that particular weekend she didn't know what the staffing was. Well, but she wasn't asked
That's the only weekend we're talking about.
Right, but now he wants to make this an issue about the practices and the common practice of the hospital, but that was not a question that was asked of her, nor would Your Honor necessarily have permitted it where he was trying to tailor the testimony to the exchanges with the defendant. So to then have the witness available to answer those questions that was at the facility during that time period, and then not take that opportunity and offer this subsequent witness and call it a rebuttal witness, it's not a fair line of examination. It's not a fair line of rebuttal where she wasn't there during the time period. So we would object for all of those reasons.
I mean, just so everybody knows where I'm going, I can't imagine that that witness would be allowed to give her, in a sense, review of McLean's. If it's 5-star and she may say it's 2-star, you know, this is not TripAdvisor. I wouldn't allow that.
And no one...
But the question seems to be, for me, a closer call about what the standard staffing and programs may be available on a holiday weekend. Because the Commonwealth's witness said, I don't know that. And that seems to be something that maybe the parties could come to an agreement about establishing. Either, you know, there's got to be somebody who's still working there that says the weekend, 2 weeks, the weekend after this wasn't a holiday, we have X amount of people there. We have X amount of programs that are available. On the holiday weekend, we do or we don't. That's, to me, that's where the battle on this motion is. I do understand the Commonwealth's objections regarding allowing people who watch the trial to then say, I disagree with it, and I want to testify about what I disagree with. That's troubling, but I'm talking about the facts on this thing. And that's if it was anything other than those kind of facts, and this witness had not worked there, I'm not sure we'd even be having this hearing.
And I would suggest that counsel indicated that in trial practice that people are reluctant to give information to the defense. But there are avenues, procedural avenues, that he could pursue to get that information involving the court or involving subpoenas, in which there's been no indication that he's actually tried to do. And again, I would suggest to the court that we have the McLean records from that time period in evidence, and they are the best evidence of the contact that people there, staff that were there that day, had, or those 4 days, had with the defendant on that day. So from the perspective of if there's missing information, there are avenues he could pursue if he wants to rebut it. I would suggest that this person's testimony is not relevant because they weren't there, and I would agree that the better option from if defense wants to present this as a rebuttal would be from somebody that is there, but he doesn't have that. And so for those reasons, this motion should be denied.
And you don't have to commit to this at all, but it seems to me that it would be a very simple solution to get the staffing records or somebody at McLean's who can testify to this. What was the program availability on the mid-December weekend, if you went in there, as opposed to the weekend of New Year's? And it may be no different whatsoever, and that kind of eliminates the argument. So I think probably the best way to deal with this is to maybe have a voir dire of this witness in regards to what, so then the record's clear too. But it also allows the parties to consider while we're setting this up, maybe there's another way to do it, a lesser alternative, so to speak, that would reduce the prejudice to both parties. So
And I don't know how a voir dire of this particular witness who clearly wasn't there and didn't have contact with the facility during that time period would answer Your Honor's questions. But I do agree.
Maybe we can find out. I can ask the questions and we could see. I understand the problem that I kind of had as the case was going. The individual that was probably, you would anticipate, could talk about the staffing, the difference of a holiday weekend and a non-holiday weekend, said she wasn't aware of that. So,
well, I don't know that she said she wasn't aware of the difference. She said she wasn't aware of who was there on that weekend because she wasn't working that weekend. So I think there's a slight distinction in that. But again, the witness was available. Counsel could have crossed her on that, subject to any sort of objection, and we could have addressed it at that time when the witness was on the stand. But again, that witness is under summons, and if counsel wants to recall her, he can. There are avenues that he could pursue if he wants to pursue this line of rebuttal that's short of calling this particular witness that's been proposed, is the point that the Commonwealth wishes to express.
So I'm going to take this under advisement. I want to review it. But I'm inclined, just so everybody can kind of maybe make some idea where we may go with this, I'm inclined to have a voir dire. This witness or some other witness. So maybe the defendant can get somebody who hasn't watched the trial, because I do understand there's an issue regarding sequestration, but that may be a function of a trial like this that's being broadcast. How do we guard against that? But that's not going to affect really the relevance, the prejudice, the determinations I have to make, under all the rules, 401, 403, all of those considerations that I have to make. So I'm inclined to do that unless the parties can think of I won't say better alternative, that's not fair to this witness, a different alternative that might address everybody.
We're going to be able to agree on anything, Judge, so it would really be up
I know,
to
but
the referee to make a decision.
Right. What I'm trying to do is put that out there. If the parties can agree, I think the three of you know me. I don't have a problem making a decision. I really don't. But I just kind of wanted to give everybody that opportunity to maybe craft a solution. And if I have to do it, that's kind of what I'm saying by saying I'll take it under advisement. So I'll let the parties know.
Can I just ask,
Sure.
Your Honor, if you're reviewing this, taking it under advisement, that you do look in more detail at those records, the McLean Hospital
Sure.
records, and
Yeah.
current evidence, so that Your Honor can see the extent of the contact, the extent of the notes of people who actually dealt with her. Because again, that is the issue. That is the factual issue here, is the contact that she actually had.
Yeah.
Not what maybe she wasn't offered at other points, but what she had while she was there. So I ask that you just review.
All right. I'll review that. I'll review my notes regarding the doctor who testified from McLean's. And then we can deal with this. This would be a witness that would be called later in the trial anyway. So it'll give me a chance to do that, review that, get a decision to the three of you, and then we can, depending what happens, either schedule a voir dire or go from there. All right? But all right, thank you for everybody for kind of agreeing to argue this a little bit earlier, so it gives me a chance to review the records and the arguments.
So moving into December 1st, again, were you able to send her a message?
She sent me a message on December 1st, and I did reply to it.
Okay, so December 1st at 12:20 p.m., we have a message from Lindsay Clancy. Hi, Rebecca. I really don't like the way I feel on the Remeron, and I know that I can't stick with it, or I can't stick with taking it. I started having very intrusive thoughts that I never had before. I didn't take it last night. I would really like to go back to Julie's original plan of Prozac in the morning and using Ativan and Benadryl at night as a Band-Aid until I get to a therapeutic level of Prozac. Please let me know if you agree with this plan. I know that I need to give it a good couple of weeks to work. Is that the message that you first received on December 1st?
It was.
And were you aware that that same day that Lindsay had reached out to her primary care physician asking for an immediate appointment with her nurse practitioner?
I was.
And that she was looking to discuss medications?
Yes.
Do you know if she actually got an appointment or went to the appointment there?
They had reached out to her, and she did not respond to their voicemails or my chart messages, so she did not see them that day, to my knowledge.
So you're able to review the notes from the network of South Shore Health, right?
Correct, yes.
So you were able to review that she asked for an emergency appointment. They were able to find her an emergency appointment, but she didn't get the back in enough time to actually get there.
Correct.
Okay. And so in the meantime, you're having a back and forth with her during the course of that day, December 1st.
Yes.
When she indicated to you in this message on December 1st about having intrusive thoughts and not liking the Remeron and not taking it, what was your response?
I sent her a detailed message of signs and symptoms of postpartum depression and anxiety, including factors like onset, risk factors, predictors, common symptoms, and it highlighted how intrusive thoughts are quite common in postpartum depression and anxiety, and I asked her, I'm wondering if that's what's going on here. I then asked her if she was able to take the Seroquel that night and if she noticed any improvement in terms of sleep or anxiety with the Seroquel.
Now, by giving her this information about postpartum depression and postpartum anxiety, was that consistent with a diagnosis that either you or Julie had given her in coming into the clinic?
Yes. We were thinking this could be some postpartum anxiety, and I wanted to familiarize her with the symptoms so that she had them written down and she could report them to me and understand that they are part of these disorders.
Okay. And you also gave her some information about obsessions and compulsions, right? Mm-hmm. And you said you asked her about the Seroquel and asked about sleep, right?
Yes. And
did you also reiterate that you were still encouraging to keep up with the Remeron for a period of time?
Yes.
And you further indicated to her that you wanted to kind of see if there was a correlation between the symptoms and the medication and that you just didn't have enough data.
Right.
In response to that message, she actually responded at 2:36 on December 1st, correct?
Yes.
And she indicated, thank you for the information, it was helpful. That she says, I panicked last night and just took Ativan and Benadryl, but tonight I'll stick with the plan and try the 15 of Remeron and the 25 of Seroquel. Do you recall if you had ever had a conversation with her about kind of using Ativan and Benadryl as a backup, or if she just felt like she wasn't getting any relief?
I recall having a conversation about using the Ativan as a backup. I believe it was Yeah, well, yes, in my initial, I said continue the Remeron and the Ativan as needed.
Okay.
Yeah.
And what about the Benadryl?
The Benadryl, I don't recall discussing.
But you were aware that she had reported the combination of Ativan and Benadryl had worked for her before.
Right.
And in that message, she also says, I'm sorry for all the messages. It's just a scary, very scary, stressful time for me. And starting new meds with side effects is very scary to me. I'll check in the morning and let you know how it went, right?
Right.
Okay. And again, you continued to have some contact with her on that same day after that.
I believe I responded to that, reassuring her that it's understandable to have fears, concerns about starting medications, and I sent her a detailed description of common question and answers I get from patients about medications, things like what to expect, how long does it take to work, what are common side effects, risks for, is there any risk for suicide, homicide with medications,
So in providing all this information with her, what were you trying to do?
Provide information because she had said it was so scary starting medication, so I wanted her to be equipped with understanding and what to expect possibly.
And based on your interactions with her and your review of Julie Paul's interactions with her, this was a person that was very receptive to taking information, right?
Yes.
And as her role as a nurse, she was not afraid to ask questions. Is that fair to say?
No. Yes, she was not afraid.
And one of the things that you provided her, or the information you provided her in this detailed response back to her on December 1st at 3:04, was that there are other sources or resources that she could utilize that are available at the clinic, right?
Yes.
And
go ahead.
These two books, Exhibit 148.
Yep.
Good Moms Have Scary Thoughts, and this one, The Pregnancy Postpartum Anxiety Workbook.
Yes.
To you?
Yes, I instructed her that we had copies of these books that we were giving out to patients and that she should come grab them when she was in clinic. And she informed me she would be seeing Letitia the next day for counseling, so she would grab them when she was there.
Okay. And so that day, December 1st, fair to say you went back and forth with her from about 12:30 to her last message, she was at 4:37 that day.
Yes.
And you said that she indicated that she did have an appointment the next day with Letitia Dukes.
Yes.
And were you aware of whether that was an in-person meeting?
Yes, it was in person because she said, I'll be in clinic, I'll be able to get those resources.
Okay. So moving to December 2nd, you didn't have a scheduled appointment with her, correct?
I did not.
And you knew she was going to see Letitia that morning in clinic, right?
Correct.
And you received several messages from her that morning.
I did.
Again, through the MyChart portal?
Yes.
Beginning at 7:51 a.m., where she sends you a message saying, "Hi, Rebecca. I took the 15 Remeron and 25 Seroquel. I woke up at 12 with horribly intrusive thoughts of wanting it to be all over. I took 1 milligram Ativan and went back to sleep, and the thoughts went away. Now that I have the Ativan on board, I really need to explore the option that I'm addicted to Ativan. I have a therapy appointment with Letitia in your office. I would really like to speak with someone in the substance use clinic to explore the option." Do you recall getting that message?
I do.
Okay. And did you respond to that message?
I did. I am credentialed at Cellshare Health and Addiction Medicine, so I felt that I could be that person to discuss those concerns with her.
Discuss the substance use concerns?
Mm-hmm.
And so, and you're aware that the social workers can also screen for those as well?
Yes.
So at 8:51 on December 2nd, you respond to her, right?
I did.
And what do you tell her about the concerns she just expressed in her 7:51 message?
I fully appreciate and understand the concern for benzo tolerance. It's not something I want to happen to my patients ever. That being said, there's a place for benzodiazepines, especially at the beginning, an acute phase of treatment and getting someone stable. And then we would always pull back slowly. I think another thing to try tonight would be to take 50 milligrams of Seroquel, the 2 tablets, and see if that works better. The intrusive thoughts are part of postpartum depression, anxiety, very painful to think and experience, but I want to reassure you that it's not uncommon and mean nothing about who you are as a mother. Let me know what you think.
And so the recommendation from 25 to 50 milligrams of Seroquel, is that still within the range for treatment for insomnia?
Yes.
So would you characterize that as a low dose, a high dose?
A low dose.
And as far as her statement about intrusive thoughts, fair to say your response doesn't ask her more specifics about those thoughts, right?
No.
But you reiterate to her, just as you had in the lengthy messages where you provided information, that intrusive thoughts are pretty common.
Correct.
Now, did she respond to that message?
She did.
And so at 9:04 on December 2nd, there's a response from Lindsay Clancy. I'm willing to try anything. I just keep coming back to the feeling that I'm dependent on Ativan after my 2.5 weeks of taking it daily with Benadryl, following the bad reaction to Zoloft. I feel addicted to it, and I feel like I'm not being heard that is a possibility. I feel like we are throwing all these different meds at my insomnia when the root cause is Ativan dependence. I don't feel any of the anxious thoughts I had before. I feel completely numb. So you got that message from her at 9:04, correct?
I did.
And what was your concern when you got that message, or did you have any concern?
I wouldn't say I had concern. I just wanted to, again, provide her some information about what I thought might be happening.
Based on your training and experience as a psychiatric nurse.
Sorry, she didn't finish her answer, please.
Okay, yep. Go ahead.
I was finished.
Okay, well, she's finished. All right, next question.
Based on your training and experience as a psychiatric nurse, and you said you had some experience with substance use, did you feel that there was a dependency issue or an addiction issue with Ativan?
I did not.
Is it fairly common that Ativan is going to make somebody feel better if they're feeling anxious?
Yes.
That's why you take it, right?
Yes.
And that's why you take it as needed. Is that fair to say?
Yes.
So in your response to her at 9:37, do you make clear to her the difference between dependence and addiction?
I do.
Okay. And as far as benzodiazepines go, there is a real concern for dependence and addiction in the fields. Is that fair to say?
Yes.
But based on taking it for 2.5 weeks, taking it to address actual symptoms of anxiety, did you have a concern of dependence?
No.
And so did you articulate to her that anything about that concept of dependence versus addiction? What did you say?
I said, I wonder if you fear you're becoming dependent on the benzodiazepines, and there's a subtle difference between dependence and addiction. With addiction, there's a change in behavior caused by biochemical changes in the brain after continued substance abuse. The substance use becomes the main priority of the person with the substance use disorder, regardless of the harm it causes to themselves or others. With dependence, we're referring to physical dependence on a substance characterized by symptoms of characterized by symptoms of tolerance and withdrawal. Benzodiazepine withdrawal is similar to alcohol withdrawal symptoms. We would be seeing things like elevated vital signs, high blood pressure, tachycardia, diaphoresis, mild alteration of mental status, initially with a possibility of perceptual disturbances, delirium, dysphoria, and tremors. Did the insomnia predate the Ativan use? I hear your concerns about the benzos. So my recommendation is do not take them every night. I recommend taking only every other night, and then we will not refill it.
And so what's diaphoresis?
Sweating.
Okay. And in the fields of prescribing psychiatric medications, do you often have to deal with physical dependency and then addressing it later?
I wouldn't say often.
Is there a way to address that as far?
Absolutely, yeah.
And so that wasn't a concern of yours regarding Ativan, was it?
Not at that time.
And what about her statement about not being heard? Did you see that in her message, where she says, "I feel like I'm not being heard," about addiction?
That being a possibility.
As a psychiatric nurse practitioner dealing in psychiatric medicine, is it important to you when a patient tells you that I don't feel I'm heard?
Yes.
And do you take that in consideration when addressing them and continuing to build that relationship?
Yes.
And so in this case with the defendant, with Lindsay Clancy, did that change your approach with her at all?
It's why I sent the message that I did, trying to explain what addiction versus dependence and tolerance is. And I wanted to reassure her that we will try to have you take these less frequently and we don't need to continue them moving forward.
So she advocated for herself, and you took that into consideration and created an alternative plan, or suggested an alternative plan?
Yes.
Did your care of her change at all when she told you she wasn't being heard?
I wouldn't say it changed.
You treated her as you would any other patient, right?
Correct.
Now, you continued to have messages with her throughout that day. Is that fair to say?
Yes.
And so at 10:02, you receive a message from her. It says, the insomnia started from the Zoloft, but then after the 2 weeks of daily Ativan and Benadryl use, that's when the insomnia was at its worst. I've tried so many different sleeping aids at this point, trazodone, Ambien, Remeron, Seroquel, and they all seem to barely touch the sleep until I take Ativan with them. So tonight I will try 15 of Remeron with 50 of Seroquel. I fear that if I wake up in the middle of the night with intrusive thoughts again, I will feel like I need Ativan. Do you recall her sending that message at 10:02?
I do.
And that she sent another message, it's kind of cut off, but it's still within the 10 o'clock hour, where she adds, I also just feel concerningly numb right now, like I have no emotion whatsoever. I feel like I'm going to die and I don't care. What do I do about this?
I do recall that message, yes.
And this is a message that she sent when she would have been or have seen Letitia Dukes already, right? If she had a 9 o'clock appointment?
Yes.
When she sent that message to you, did you respond back to her at 11:35?
I did.
And with the fact that she talked about being numb and having no emotions, feel like I'm going to die and don't care, what did you do?
I said, this sounds like depression and anhedonia symptoms. I would say if you're feeling unsafe, particularly as we head into the weekend, it is important for you to have information for psych emergency services available to you. And I provided a list of the 24-hour emergency service programs like mobile crisis intervention.
Okay. And when you say anhedonia, excuse me if I mispronounced that, what does that mean?
Anhedonia is a symptom of depression where people are unable to feel pleasure. They might describe it as feeling numb. They're unable to look forward to things.
Okay. And in her message where she says, I feel like I'm going to die and I don't care, did you take that as a suicidal thought or suicidal ideation?
No.
And so did you tell her to go to the ER right away?
No.
Okay. Did you have concerns that she needed to get a higher level of care at that moment when she sent that message?
My concern about that statement was that I wanted her to have access to resources if it escalated or if it worsened. So I made sure she had it.
Okay. And fair to say you also, at the end of that message, indicate, are you able to get rest or reach out to your support system so that you can be helpful, so they can be helpful to you right now, and that this is hugely important?
I did say that, yes.
And 11:41 a.m., she responds, yes, I have support. My parents are here to help. And again, this is 12:02. Does this sound like side effects to Remeron or Seroquel? I have never felt anything like this before. And then 11:57, she sends another message. Do you think over time these symptoms will go away over time? 12:04, another message from her. Is there any chance you could give me a call to discuss when you have a minute? At 12:10 p.m., and just to confirm, your recommendation for tonight is 15 Remeron, 50 Seroquel, and avoid Ativan, even if I'm not sleeping. So you got those messages in succession, right?
I did.
And were you able to eventually respond to her with a phone call?
I responded to the message at 12:12 p.m. I wrote it down for her.
And again, in your response to her, did you reiterate that these are pretty common signs of depression, and that what she was expressing to you wasn't uncommon in women with postpartum depression?
Correct. I said it sounds more like depression than side effects. It's not uncommon for me to hear, I've never felt anything like this before, or I just don't feel like myself. All of this sounds like postpartum depression.
And did you further try to give her some encouraging words?
Mm-hmm. I shared a passage from a book called This Isn't What I Expected.
And is that book kind of centered around postpartum depression?
Yes.
And did you also tell her this is going to get better?
I said, even though they feel terrible, remember that they're symptoms of an illness that is very real and very treatable. This is going to get better.
And after that message on 12:12, did you in fact send her another message?
I did.
And fair to say that next message was to kind of address the concern about her question what to take.
Yes.
And you confirmed to take 15 milligrams Remeron, 10 milligrams Prozac, and 50 milligrams Seroquel.
Yes.
And that taking Ativan every other day might help.
I said, I would say taking Ativan every other day might help you to see you are not addicted, as one cannot be addicted to something they don't take every day, but we can also decide to let me be concerned about whether you have a problem with the Ativan and simply take it nightly for now. And if I have concerns about your use of it, I will make them apparent to you. My primary concern at this time is that you sleep, and if that means taking the Ativan for middle of the night wake-ups, that is what it means. I'm confident we can safely and successfully get you off Ativan in the near future. And then I also go on to make recommendations about if she does have trouble in the middle of the night, certain sleep hygiene techniques that she could do, like getting out of bed and doing something non-stimulating, and then go back down to try to sleep again when you feel drowsy.
So an alternative to medication intervention.
Yeah.
And then at 1:40 p.m., she responds, thank you, I'll stick with that plan. I really hope it works, and to feel like myself soon. Right?
Yes.
And then at 2:35, you respond, we will follow you closely. We have lots of alternatives. If this for some reason isn't the combination, we'll find one that gets you back to feeling like yourself.
I did say that, yes.
In all your treatment of women, the women that you've treated with postpartum depression, is this common that you have to kind of trial different plans in order to find the right one?
Yes.
But you increased the amitriptyline.
Yes.
And that pushed you over the edge, didn't it?
I don't think so.
Jennifer Tufts was treating Lindsay Clancy the day before Lindsay strangled her 3 young children to death and then exited a second-floor window of their home, leaving herself paralyzed from the waist down. Now Lindsay is on trial for triple murder, but is pointing the finger at her mental illness and Dr. Tufts. Meanwhile, Lindsay's now ex-husband, the father of the 3 children, also believes Lindsay is not criminally responsible for killing their children.
That was really where her big spiral started. She started to lose a lot of weight, and she became very depressed, and she was having a really hard time. Yeah, she started to say she was suicidal.
It's the trial that the nation is watching, a case that has divided the community as to what should happen to Lindsay Clancy. Should she go to prison, or should she be put in a mental health facility?
I discussed with her and her husband the possibility of potentially an underlying bipolar disorder.
And today, more compelling testimony connected to the weeks, days, and hours before the horrific killings as a jury tries to figure out why Lindsay Clancy did it. Lindsay Clancy was absolutely seeking help, but one of the issues in this case is what was her condition? What was her actual mental illness? And was the treatment helping her or making it worse? I'm Vinny Politan. Let's investigate. I want to begin not by speaking about Lindsay Clancy, but speaking about her former husband, Patrick, the victim's father. And his role in all of this is really quite unique because on the one hand, immediately after all this happened, he forgave his wife at the time and asked the world to forgive her. So clearly he doesn't believe that this is a criminal case that should have been brought. He believes that this is a case involving prosecutors going after someone with mental illness, his former wife. But something else has happened here now with Patrick Clancy, is this level of internet skepticism towards him. Not that he's not a victim in all this, but he's the actual killer. Like he's being accused of framing his wife for this on the internet for many reasons, including his shoes. But when we get back to what's happening inside the courtroom, not what's happening online and all that chatter, I mean, both sides agree here that Lindsay Clancy is the one who is responsible for taking the lives of those 3 children. What they don't agree on is why she did it. Was it just like evil, or is she the victim? And when I say the victim, what the defense is talking about is being a victim of mental illness, a victim of improper treatment, a victim of the wrong medications, which made her condition even worse. So that's what this jury has to figure out. Is she evil or is she the victim? And one of the issues that the defense has brought up is bipolar disorder. And they have claimed in this trial that she was misdiagnosed or undiagnosed as being bipolar and was given medicine that is the exact opposite of how you would treat someone with bipolar. Medicine that would make it even worse. So as you watch this testimony, this section becomes very important. This is one of the nurse practitioners who treated Lindsay Clancy. Her name is Rebecca Gelada. And in this part of her testimony, she's talking about bipolar. She's talking about Patrick. She's talking about Lindsay. Let's take a listen.
When you met with Lindsay and Patrick on December 6th, did she or did they report why Patrick was there?
I don't recall if they indicated why he was there. I understood it to mean he was there to provide collateral and support for her.
Were you aware that he was coming to the appointment?
I don't recall if I was aware beforehand or not.
And you had engaged in a pretty significant my chart back and forth with her in the days preceding this this meeting on December 6th, right?
Yes.
Did she ever indicate to you in those messages that she wished to bring him along to one of the visits?
No.
Fair to say, when a person brings a collateral and is willing to have somebody speak, you're more than happy to get that information.
Absolutely.
This person, this collateral person, can they offer you a different perspective about the patient and what they're going through or what they're, how they're presenting?
Yes.
In this December 6th meeting, or the visit, did she report to you some changes in her sleep or significant concern for sleep?
I would have to review the note. What I remember is that the sleep really hadn't improved much beyond getting a few hours, waking up in the middle of the night, maybe piecing together more time.
And fair to say there was some conversation to go back and talk about when symptoms started and try to get to kind of the root cause or what they believe the root cause of her symptoms were.
Yes.
And did Lindsay and Patrick report to you the connection with the Zoloft medication in September as a concern?
Yes.
And that they reported that, or she reported, that exact night I went from 25 to 50 milligrams, I didn't sleep for 48 hours, and I wasn't tired.
Correct.
So that's in your note as a quote, meaning that's directly what she told you?
Yes.
Okay. Did you express to Ms. Clancy thoughts that you had about her diagnosis based on your interactions over the last few weeks?
I did.
And what was that?
I discussed with her and her husband the possibility of potentially an underlying bipolar disorder. I based this on several factors, one of them being that she had such what we call an activating response to the Zoloft. It's unusual for somebody to describe taking Zoloft and then going 48 hours without sleep and not being tired. So that raised my clinical suspicion a bit. And she had been, I would say, having difficulty tolerating other antidepressant medications that we had been trying to have her take since then. And so again, I'm wondering if it's because potentially there might be an underlying, what we call mood disorder, bipolar disorder.
And as far as the information that you had about her past psychiatric history, were there any indicators to you about manic episodes?
No. So I do recall in reviewing Julie's note prior to meeting with Lindsay, she filled out what we call a mood disorder questionnaire. It's like a screener somebody can do to assess history of mania and bipolar disorder. Lindsay it was a negative screen. So there's 3 questions. One question has 13 different symptoms. You have to score 7 out of 13 on question 1, but also in question 2, it asks about, are the symptoms happening at the same period of time? And then it asks about any functional impairment from the symptoms. So I recall the 3 symptoms she did endorse were not sleeping for that period of time with the Zoloft and not feeling tired, having racing thoughts, and trouble concentrating. None of the other symptoms did she endorse. They did occur at the same period of time. And I don't want to be inaccurate, so I can't remember what she said for functional impairment, but I believe it was minor impairment.
When you explain this to them, your thoughts about her reactions to the medication and these reported prior symptoms, did Patrick and Lindsay seem receptive to your diagnosis?
I recall Patrick saying, "My wife is not bipolar." Lindsay looked at me. She did not say anything.
What did Lindsay Clancy express to you as far as Seroquel? Did she want to continue with that?
No.
Did she explain why?
So she felt like when she took Remeron and Seroquel together, she felt weighed down and exhausted, but her mind was still awake and alert, and she just didn't seem to think there was a benefit to being on it.
And so did she express to you a desire to want to go back to trialing Prozac?
Both Lindsay and her husband expressed that that was their preference.
And was that something that you agreed with?
I did. I had shared with them that I had concern this could be bipolar. It's in my differential diagnosis, which is just all the typical diagnoses we might be considering. And that typically SSRIs are contraindicated, but she did have that history of being able to tolerate Prozac at 20 milligrams and do okay with no mania. So I thought that's what they were wanting to do, so we could do it. We could try it.
When you say contraindication,
okay, sorry.
what does that mean?
It means typically not something you would want to do if you were sure somebody had bipolar disorder, because if you put somebody on just an SSRI or like Prozac, like Zoloft, it can create a scenario where people are flipping back and forth between manic symptoms and depressed symptoms, or they're called rapid cycling. It's not that antidepressants or SSRIs are never prescribed in bipolar disorder, but you often would want to have a mood stabilizer on board at the same time.
Hold it right there.
And so,
and this plays right into the defense, right? This is what they're saying. They're saying she had bipolar. She's given Zoloft, which is what you're not supposed to do. And here we have this nurse practitioner who seems to be cognizant of that fact, obviously, number one. And number two is curious about what the diagnosis actually is. And all of this plays to the benefit, I believe, right now, to the defense. But let's watch some more.
Despite your suspicions, you listened to the patient and went along with her request.
Yes.
So at the conclusion of that meeting, did you indicate that she could discontinue the Seroquel at that point?
Yes.
With the plan that she was going to restart Prozac?
Yes.
So on December 7th at 9:48 a.m., she sends a message saying, "Hi, Rebecca, last night did not go well at all. I took the Valium and melatonin and slept only slept from 9 to 1. Then around 2, I got desperate and took 25 milligrams of Benadryl and only slept about 1 more hour. What can I do? I really need help." So that was the message that you came into on December 7th, right?
Yes.
And did you respond to her in the messaging app?
I did.
And what was the response?
I'm trying to find the sequence.
Be at 10:19 a.m.
Then it gets cut off. Okay, so I discussed, I mentioned, so your husband made a good point yesterday. Despite taking the Ativan in the evening, you were still only able to get a 5-hour stretch of sleep, which, yes, is improvement, but does sort of dispel the notion that benzodiazepines are the only thing that are helping you sleep right now, as you are still getting less than the target of 6 to 8 hours with Ativan, and the Valium did not help for sleep much at all. My next step in this case is to try a higher dose of Seroquel on its own. Are you feeling any subsequent loss of energy, exhaustion, fatigue with lack of sleep?
Why would it be the next step to increase from 75 of Seroquel to 100?
So she had been taking 50, so I was suggesting 75 to 100 would be my next step, because again, bipolar is still on my differentials, and now I have the data that she only slept 2 hours. So I asked her the follow-up question, are you feeling tired, or, are you feeling exhausted, any subsequent loss of energy? It's still in the back of my mind that this could be bipolar.
So as far as the Seroquel goes at that point, creeping up the dosage, do you get now from the using it to treat insomnia to using it to treat something else like bipolar?
Correct.
And so that piece of it about feeling a subsequent loss of energy and exhaustion, fatigue, why ask that?
Patients can have insomnia because they're anxious or because they're depressed, but typically they're exhausted or they're tired the next day, and it really does affect them. If a patient has an underlying bipolar, they could go on 2 hours of sleep and not feel tired at all, and that's unusual.
And so that is one of the signs, potentially, of a manic episode?
Potentially, yes.
So on December 7th at 10:33, she responds, "No, the weird thing is I don't feel tired at all." And she says, "So just Seroquel tonight, ? I feel like I'm going to panic without a benzo with it." And then again at 11:44, another message, "Would I be able to do the Valium with Seroquel? Is that a safe option?" So again, in this exchange with her in my chart, she's asking you questions to clarify what you've said and also alternatives to address the issue, right?
Right.
And as far as her questions go, and then her response about not feeling tired, how did you respond in the message?
So she kind of sent those in succession. So I don't feel tired. Would I be able to do the Valium with the Seroquel? So I respond by, if you're not sleeping well with the Valium alone, there's no need to continue it, and I will prescribe a short taper to get you off benzos altogether. Because you are not tired at all and had a significant reaction to Zoloft at 50 milligrams, I'm concerned this is an underlying mood and bipolar disorder. I know you and your husband did not necessarily agree with that, but I feel that I'm going to send along this information to review. So I sent her a list of symptoms of bipolar, risk factors, so that she could have it to refer to.
And again, at this point, the only symptom she was reporting of mania was this not being able to sleep and not feeling tired, right?
And yes, and the racing thoughts and the trouble concentrating.
Okay, is that things that she had reported to you in your visit on the 6th?
No.
Okay. In these messages that she was sending to you in her on December 7th, she didn't talk about racing thoughts, did she?
No.
Okay, she just talked about the sleep?
Mm-hmm.
Okay. But based on a review of her history, she had at one point indicated that she was feeling those in relation to a symptom she was describing. Is that
correct?
So at this point, what do you recommend her to do?
I explained the importance of knowing if this is bipolar is significant, because SSRIs like Zoloft and even Prozac would be contraindicated. My recommendation is to do 100 milligrams of Seroquel tonight, 200 milligrams of Seroquel tomorrow night, 300 milligrams on 12/9, 400 on 12/10, and we will hold there. I actually say hold the Prozac, as I'm concerned this is a hypomanic mixed manic state.
All right. What you're hearing from the prosecutor is trying to minimize this whole issue of bipolar because it's part of the defense case. But she keeps saying it. And the bottom line is the jury is hearing it. So one of the questions for this jury is going to be, was she bipolar? Was it postpartum psychosis? Was it just generalized anxiety disorder? Got to get to the bottom of all of this. And that's what the jury's got to try to figure out. So let's take a listen to more of the direct examination of Rebecca Gelada, the nurse practitioner, who seemed to dive a little deeper than Dr. Tufts did in trying to figure out what was going on with Lindsay Clancy.
And so when you saw her in this virtual visit on December 13th, was she reporting improvement in her sleep?
Yes.
And how was she sleeping during that time period?
7 to 9 hours.
Okay, and that was holding at 200 on the Seroquel?
Correct.
And was she taking anything else daily?
Valium, 2.5, just once daily at night.
Okay. And while she reported sleeping better, she still had significant symptoms of depression, right?
Correct.
And what were the symptoms she articulated?
Hopelessness and, again, anhedonia, that feeling no pleasure, feeling numb.
Okay. And she also kind of complained of that racing heartbeat, and that's tachycardia, right?
Yep, the orthostatic tachycardia. So I recommended holding a bit longer at 200 milligrams. At this juncture, she had been on 200 milligrams for 4 nights. I wanted to continue it for a full 7 nights. And then we were still discussing whether to taper benzos, and our plan was to kind of slowly phase them out at that point. So we were going to decrease from 2.5 milligrams daily to 2 milligrams for 7 days, and then we were going to reassess at our next visit in a week.
So December 15th at 3:53 p.m., you have a phone call with them. And what did they report to you in this phone call? What does Lindsay report?
They informed this has been the worst day for Lindsay, is having persistent intrusive thoughts of suicide, no active plan, but both Lindsay and Patrick agree that higher level of care may be necessary at this time. Discussed options, they state they are likely to go to MGH ED, as they have perinatal psychiatry as well as an inpatient psychiatric unit. Lindsay also deciding about McLean. This writer advised that they keep us posted and sign a ROI, release of information, so that we can communicate with treatment providers at higher level of care. Lindsay verbalized understanding and agreement.
On December 16th at 12:50, that she, after visiting the ER yesterday, I opted to remain outpatient and pursue the partial program at Women and Infants. And Women and Infants, that had been the program that you had previously recommended in Rhode Island, correct?
Correct.
She indicates, I'm waiting on a call back for them to schedule. In the meantime, I want to know how to proceed with my meds. Do you still recommend the 2 milligrams of Valium and 200 of Seroquel nightly? Again, it's making me sleep well, but still not improving my mood. So I will need a refill on those meds. Please let me know.
I said, hi, Lindsay. I know Letitia may have called you yesterday about information about women and infants, so I hope you were able to connect with her. Target dose for Seroquel treating depression is 300 milligrams, so we can increase it to 300 milligrams. If you are willing, yes, continue the Valium. Let me know what you think.
In her messages later in the day at approximately 2:11 p.m., she indicates, I spoke with my original psychiatrist after my ER visit, and she recommended adding 25 milligrams of Lamictal to stabilize my mood. Is that something you would agree with? Had you ever talked with her about Lamictal before?
No.
Is it a drug that you kind of commonly recommend for people?
I do.
And was it something that you thought could be a good fit for this patient?
Yes.
Okay, but as far as now what you know to be the medications that she's been advised to take, what are they at this point, December 16th?
Lamotrigine, 25 milligrams, Seroquel, 300 milligrams, and Valium, 2 milligrams.
And the Valium, is that still a daily recommendation?
Yes.
Does she indicate to you in that message that she is starting with Women and Infants partial hospitalization tomorrow, meaning the 20th?
Yes.
And that she's concerned because she has an appointment scheduled with you already, and she's asking what she should do about that, correct?
Correct.
And what was your response to her?
So she has an appointment but should be in the program. Should I call and cancel or reschedule because she thought the program would be starting her medication? I said, I'm so glad you were able to get into the program this week. That's great. So feel free to call and reschedule. The only issue is that I am on vacation next week, so it might be 2 weeks out that we touch base again if that's okay with you. Let me know what you think.
Okay. And her response at 1:24, that says, I think since I'll be followed by Women and Infants, that 2 weeks out will be okay. My only concern is potentially needing more Valium before that. I'm trying my best not to take it at night, but have still been taking 2 milligrams every other night. Can we refill that just in case I continue to need it? Do you recall receiving a message on December 20th via my chart from Lindsay?
I do.
And she reported to you that she had been discharged from Women and Infants that day, correct?
Correct.
And that they recommended she find help getting off the Seroquel, and that she was indicating that she'd like to taper the Seroquel.
Yes.
Did you respond that day or the next day?
The next day.
Okay.
Her message came in at 8:05 p.m., so I responded the next morning.
Okay, 10:57?
Yes.
And what were your thoughts about her report that she was discharged and the recommendation for tapering the Seroquel, or getting off the Seroquel, I should say?
I said I'm not opposed to that. However, I'm concerned she discharged you, as I do feel you could benefit from the groups and added support separate even from medication changes. In fact, if we're not going the medication route, I think groups and therapy are the treatment needed, as I feel the intrusive thoughts you've been having are nonetheless concerning, and I know they've caused you considerable distress. I'm also on vacation next week, so I'm hesitant to start a taper when I am not available to you for questions and concerns. Again, I'm open to starting a taper, but I want to be available to you as it happens. You mentioned you are connected to your previous psychiatrist. Would that be someone to consult as well? Yes, I asked my nurse to call to, again, go over the risks of tapering, which could include worsening of mood, worsening of sleep, verify that this was really something she wanted to move forward with, remind her that I wouldn't be there.
Okay. And on December 21st, 2022 at 4:26 p.m., you respond to her in the MyChart message, right?
Right.
And you had expressed reluctance for the taper, but ultimately did you provide her a plan for taper?
Right. I said, I know Nicole reached out to you and she relayed that you would like to proceed with the taper. I'm sending as 100 milligram tablets, 200 milligrams, 2 tablets for 4 nights, 100 milligrams, 1 tablet for 4 nights, 50 milligram tabs, half tablets times 4 nights, then off. Let me know if any issues.
And is that a standard or slow taper off of Seroquel being at a 300 milligram dose?
Considering the fact that she had only been taking it for a few weeks, yes. If she had been on it for months, I would have done a slower taper.
As far as the perinatal behavioral health clinic at South Shore, you're aware that on December 30th, Patrick Clancy called in about his wife.
Correct.
And that he spoke to a nurse, Katrina Melanson.
Yes.
And the record reflects that he reported that she was safe, right? But she'd like to go to McLean.
I do recall that.
Okay. And he was advised to take her directly to the emergency department. You can't just go there to McLean, right?
Right.
In your experience?
In my experience.
And that he said he didn't want to waste a day in the ED. Is that your recollection of the record?
That is my recollection of the record.
And that he was looking just to get the bed that was offered the last time on December 15th.
Yes.
And it's fair to say that that's not how the process works?
They do not hold beds for that length of time.
Okay. And so then he was advised to take her to the emergency department or call 911?
Correct.
And was that the last contact that the South Shore Perinatal Behavioral Health Clinic had with Lindsay Clancy?
Yes.
And she goes to McLean. She gets out in a few days, and then Nurse Gelada's not treating her anymore. So her treatment ends. But what's significant about her treatment, again, is this discussion about what exactly is going on with her. What is she really suffering from? Are we getting it right? And all of that plays right into the hands of the defense. All right, so let's get into the cross-examination now of Rebecca Gelada, the nurse practitioner who treated Lindsay Clancy. Her direct, I thought, was kind of helpful for the defense. So let's see how much further the defense takes some of this testimony and takes some of the observations and analysis that's being done by Nurse Gelada.
Did you talk to Tufts?
No.
Did you ever get access to Tufts' medical records?
No.
Do you know how many times she saw Dr. Tufts?
I do not.
Would it surprise you if I told you that she saw Dr. Tufts 14 times in the time frame of October or the end of September, October, November, December, and then January, 4 months?
Yes.
And that's 14 times plus the 3 that she saw you. Is that right?
Yes.
So that's 17 times that this young lady had access to healthcare providers for her mental health issues, correct?
Correct.
And that would be within a compressed period of time. I know it's the last week, I believe, in September, but October, November, December, and then January, right?
Yes.
And during that period of time, you're aware that she was provided many, many, many prescriptions for antipsychotics, selective serotonin reuptake inhibitors, benzodiazepines, all of that, right?
I'm aware she was prescribed other medications.
She was what?
Prescribed other medications.
Did you ask what other medications there were?
Yes.
And did she tell you?
Yes.
Did she tell you who prescribed them?
Yes.
It's pretty easy to get a list from CVS, right?
Yes.
And did you have any difficulty determining who was providing the prescriptions for all of these medications?
No.
And did you know that, in fact, it was Jennifer Tufts that prescribed the sertraline, September 15th of 2022, 30 count, 25 milligrams, was Jennifer Tufts. You knew that?
I did.
You know that Jennifer Tufts on October 21st, a 7 count of lorazepam. You know that?
I did.
And 5 days later, Jennifer Tufts prescribed on October 26th hydroxyzine, 25 milligrams with a 30 count. Did you know that?
I did not know that.
Did you know that on the same day, Tufts prescribed 30 count of lorazepam? Did you know that?
I would have known that, yes.
I would.
Checking the PMP for controlled substances, yes.
You do recall that you checked with it?
Yes.
When you download, do you download that information and kind of put it in the file, in the file?
No.
So is this your memory that you believe that you checked with PMP?
I do routinely check the PMP.
You might routinely check, but did you check?
Yes. Yes, I did.
You don't download it, you don't keep it with the medical records, right?
It's a box you can click in the medical record and you can check that you reviewed it.
Okay. Is it in your medical record that you reviewed it?
I'm not sure how it would have gotten printed out. It doesn't go into my note, but it is the box that I would have checked
A box in the computer?
Yes.
Okay. October 26, buspirone, 5 milligrams, 30 count, same day by Tufts. You knew that?
Buspirone?
Yeah.
I was not sure that it was Dr. Tufts that had recommended the buspirone.
Okay, so if I suggest to you that the prescriptions that we have in evidence on the chart indicates that on October 26, Dr. Tufts prescribed a 30 count of buspirone, would that either refresh your memory or would you accept that as being a medical history?
I would accept that.
Okay. And what is buspirone?
It is a medication used to treat anxiety.
Okay. And lorazepam, what is that?
Benzodiazepine.
And hydroxyzine, what is that?
It is an antihistamine medication.
And lorazepam, again, prescribed on October 21st as well as 26th by Tufts. That's the same thing you just told us what lorazepam is, right?
Yes.
Sertraline, of course, is Prozac. Is that right?
Zoloft.
Zoloft, Prozac. They're both SSRIs, right?
Yes.
So from October 21st up through November 9th, she was prescribed all of this group of drugs until she saw a Kayvon Izadapana, Izadpanah. Do you know who that person is?
They work in the emergency department at South Shore Health?
All right. And that would have been on November 16th when she went into the emergency department, right?
Yes.
Prescribed trazodone, 50 milligrams, right?
Yes.
And then she started to consult with your clinic around the 25th of November. That would be around Thanksgiving or so, correct? November 25?
I believe her first visit with Julia was November 21st.
Okay. So what I'm saying is that it was around that time in November that she started to consult with your clinic, correct?
Correct.
You know that she was referred to your clinic by her mother-in-law, Pat's mother, who was a labor and delivery nurse.
Yes, I am aware.
Referred her to Julie Paul, who kind of stepped in for a very short period of time to try to help out, right?
Yes.
And then Julie left went to New Hampshire to continue her work, and you picked up on November 30th of 22. Is that right?
November 29th.
On November 30th of 22, you wrote a script for quietapine, 30 count. Is that right?
Yes.
And what is quietapine?
Seroquel.
You also, a week later, wrote a script for diazepam, 5 milligrams. Is that correct?
Correct.
And then the next day, you wrote a script for, December 6th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, again, you wrote a script for quietapine, 30 count, right?
I would need to check my...
You can look at anything you want. If
Okay.
you have your records, feel free, please.
Okay. You said
Yeah, it would be December 7th. I'm looking at quietapine, 30 count, 100 milligrams.
I don't believe it was a 30 count of 100 milligrams.
Do you remember writing quietapine script for 100 milligrams?
I do. I believe the quantity was 22.
22, okay. So on December 7th of 22, you wrote a script for quietapine, and forgive me, I'm sorry, what is that again?
Seroquel.
Seroquel, for 100 milligrams, right?
Yes.
And why did you write the script on November 30th for quietapine, 25 milligrams, and then about a week later increase it to 100 milligrams?
On November 30th, I had anticipated utilizing it over a 4-week course of treatment for sleep and anxiety, but her clinical symptoms, presentations changed, and we opted to use it for mood stabilization.
And who's we?
Me.
Okay. And were you working with anybody else, any psychiatrists or anybody?
No.
So when a person comes to your clinic as a woman who has recently had a baby or is within that postpartum range of time and presents with the symptomology that she presented, is that something that would give you cause for concern? Suicidal ideation?
I in no way want to minimize what Lindsay experienced, but it's common for us to treat.
It's common to treat women in that
Yes.
fashion that are postpartum?
Postpartum who may have suicide. Oh.
Keeps cutting off the witness before she gives an answer. May she complete her answer?
Sure. As I've said before, let's only talk one at a time. You finish your answer, and then we'll go to the question.
Go ahead.
Her symptoms were serious, and it's not uncommon for me to treat women with serious symptoms in the postpartum period.
Okay.
Another theme here you see from the defense, and it's another one of their big themes. This is someone who is clearly over-medicated. The themes are clear, they're simple, they're straightforward. Too many drugs, misdiagnosed, she's suffering from mental illness. It's not her fault. She's not criminally responsible. January 23rd, 2023 is a huge day in this case. It's the day before those 3 little angels are killed by their mother, Lindsay. And what was happening that day becomes very relevant for this jury to try to understand the mental state of Lindsay Clancy. I want to play for you a moment from Dr. Jennifer Tuff's cross-examination. It may have been one of the most important moments from that cross. And the reason being, it's about exactly what the doctor did, what she prescribed the day before this happened. And I think the defense wants to really lean into this in a big way and make it almost the foundation of their defense here. It's the mental illness, it's the incompetence of the doctor, and it's the over-medication all coming to a head as if it's a perfect storm of events just before Lindsay takes their lives. So let's take a listen to this moment from the cross-examination.
January 23rd, you had that meeting, correct, with her? And this is after, obviously, excuse me, the January 16th appointment And in the January 16th appointment, she told you that her mood was very low, and that's the worst that she ever reported her mood to you. Isn't that right?
On the 16th?
Yeah.
I don't know if that was the worst it was ever reported, but it was certainly bad.
And you didn't recommend that she have a hospital evaluation, did you? This is the day before she killed the kids, right?
The 23rd?
Yeah.
Was the day before?
You didn't recommend a hospital evaluation, did you?
No, there were no.
The answer is no?
No.
They'll ask you all the questions they want. Your answer is no. January 23rd, Friday, you testified that she said her mood was depressed, and you noted that her affect was depressed and flat, right?
Yes.
She also reported that her heart was racing, right?
Yes.
She had no motivation, is what she told you, right?
Yes.
She told you that she had been feeling, numb and no emotion for 17 days straight, is what she told you, right?
I'm not sure about 17 days straight, but that's how she was feeling.
You didn't reach out to her mother and father at that point? They didn't call you, I guess, right?
No.
And Patrick didn't call you at that point, right?
No.
So she's sitting in front of her computer getting help from her doctor on January 23rd. And what did you do?
I thought about how I could best help her, the medicines that she tried and what her current symptoms were, and it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
But you increased the amitriptyline.
Yes.
And that pushed her over the edge, didn't it?
I don't think so.
The doctor is so uncomfortable in that moment. That's like a mic drop moment for the defense, right? This is where they're really saying, "Doctor, you didn't know what you're doing." Then you look at the doctor's demeanor on the stand. She doesn't look confident. She looks like, "Oh, maybe I did mess up here." All that is terrible, absolutely horrific for the prosecution. But prosecutors get an opportunity to try to rehabilitate the witness or at least clarify the issue. So let's take a look now at the redirect of Dr. Tufts on this very issue, which is a huge issue for the defense. Let's watch.
You were asked by defense counsel about the amitriptyline that you prescribed on January 16th, 2023. That initial prescription was for 10 milligrams, correct?
Yes.
Showing the bottle from exhibit 155 of amitriptyline. Would you agree with me that this shows that the prescription was filled on that same day, January 16th, 2023?
Yes.
And out of this pill bottle here, there were 30 pills in this prescription, correct?
Yes.
And there are 8 pills missing from this bottle. So filled on January 16th, 16th, 17th, 18th, 19th, 20th, 21st, 22nd, 23rd would be 8 days, correct?
Mm-hmm.
And on the 23rd is when you said she could raise it to 20 milligrams?
Yes.
So if there are only 8 pills missing, she never took that additional dose, correct?
That's what I would think based on what you just said.
So the amitriptyline, increasing it from 10 milligrams to 20 milligrams, wouldn't have pushed her over the edge, correct?
Well, if she didn't take 20 milligrams, then that's correct.
That's a great job by the prosecution. And that's a big part of this case. There's what she's been prescribed and what she's actually taken, and they don't always coincide. Like, she was reluctant to take some of these medications because she thought they were making her worse. She was very skeptical of all of it, but she wanted help, and she wanted something that was going to help her. So in this case where the defense has this big moment that pushed her over the edge, and the prosecutor comes back very calmly talking about, well, there were 8 pills missing, and it was 8 days that she took it. Common sense might tell you, well, she's taking 1 pill every day. But there's still a chance that maybe, just maybe, she skipped a day and did double the dose that day. I mean, that's still very possible. But the way the prosecution left it right there, very, very effective. We are out of time for this time. Thank you so much for watching. I'm Vinnie Politan. Thanks again. And please, as always, don't forget to hug the kids.
Dispatch said that he couldn't wake them up.
It was an absolute horrific scene inside the Clancy home on January 24th, 2023. 3 children in the basement strangled with exercise ropes. Their mother, Lindsay, bloodied and paralyzed in the backyard. But this wasn't a home invasion. It wasn't a stranger who committed these acts. It was Lindsay. She admits she did it, but claims she's not criminally responsible because of her mental illness and medications. And the defense is pointing the finger at her mental health providers.
She told you that she had been feeling, numb and no emotion for 17 days straight, is what she told you, right?
I'm sure about 17 days straight, but that's how she was feeling.
But you increased the amitriptyline.
Yes,
That pushed you over the edge, didn't it?
I don't think so.
Lindsay Clancy is sitting in court in a wheelchair, facing 3 counts of murder and a life behind bars.
Hold on here. Counsel, hold on. We're going to take a short break.
And as the trial the nation is watching continues, the question remains, can prosecutors prove beyond a reasonable doubt that the mental illness did not cause Lindsay to kill her children? The intensity inside this courtroom is high. Neither side is budging 1 inch. The prosecution versus the defense, both agreeing that Lindsay Clancy did this, but disagreeing about why she did it. So ultimately, the question for this jury will be, is Lindsay Clancy an evil sociopathic killer, or is she the victim of a wrongful prosecution? I'm Vinnie Politan. Let's investigate. During the course of this trial, we've seen a real contrast inside the courtroom on a couple different levels. The first one, let's start with Lindsay Clancy and the way she's been sobbing in many parts of this case. And you can argue and try to interpret what exactly she's sobbing about, if it's the sadness of what happened to her children, or the sadness of being on trial for doing it, for realizing what you did, or not being able to control it, or having some sense of remorse. That's something that the jury will have to figure out, but it's real. It's not make believe. It's real, because you can see it throughout. Now, the camera angle isn't the greatest. You kind of get the side of her head, but it's clear that all this is impacting her inside of the courtroom. But the interpretation of that obviously is up for grabs. Contrast to that is her husband, Patrick. When he testified, he really did not break down. You saw something different from him, and I could see it in his eyes, the brokenness of his whole world imploding on him. But then, to me, at least to me, a sense of resentment and anger to being in the courtroom. And I took that from 2 parts of it: reliving everything, number 1, but number 2, not believing that his wife is actually criminally responsible, being called by the prosecution, but not agreeing with what the prosecution is doing inside of the courtroom, despite the fact that she's now his ex, and she's his ex, and he's her ex, etc. And he has a new relationship, a new family, a new wife, a new child. Despite all that, he still doesn't believe what's happening here should be happening. Now, there's another contrast here, and that's what this case is all about. Prosecutors are blaming Lindsay for what happened. It's her fault. She is the one, the only one responsible for what happened to those 3 children. And then you've got the defense, Kevin Reddington and Lindsay Clancy, blaming the doctors, blaming the misdiagnosis, blaming the medications, and of course, blaming the mental illness for all of it. So now I want to take you to the point where the investigation has begun. It's obvious that Lindsay Clancy is the one responsible, but because she exited that second floor bedroom, she's paralyzed and she is in the hospital, but not free to go. People aren't free to come in and come out of her room. She's basically in custody, but at the hospital. And this is Sergeant Dan Lawler, who testified from the Massachusetts State Police, talking about what's happening and a court order that comes into play to sort of allow someone to go see Lindsay Clancy while she's in the hospital, a psychiatrist. Let's take a look.
When you were there on watch, did you go into the room or were you outside the room?
Outside the room.
And as far as your memory of whether anyone else besides medical staff went in there, at any point when you were there at the Brigham Hospital, did you observe another individual come in to visit with her or meet with her?
Yes.
And were you advised that that person was coming in?
Yes.
And were you advised that that person was allowed in with a court order?
Yes.
Okay. When the person went in, did you know if it was an attorney, a doctor, somebody else?
It was not an attorney, it wasn't a doctor. It was, I believe, a psychiatrist.
And when that person went into the room, did you go in the room as well?
No.
And where did you stay?
Outside the room.
And when this man went into the room, did he leave the door open or close the door?
I believe it was closed.
And when he came out, did he speak with you?
I don't recall.
Okay. But as far as you knew at that time period, that person was permitted to be in there and could close the door?
Correct.
And you don't know what was said or what was done in that room?
No.
You know that nobody could get access to Lindsay Clancy in that hospital, and I mean nobody, right?
Correct.
And this went on for day after day after day, to your knowledge, facilitating, right?
Correct.
Her parents couldn't get in to see her, correct?
I don't believe so.
She had an attorney that had difficulty, not me, but another guy that had difficulty getting in to see her. Isn't that right?
I'm not aware of that difficulty.
I had to get a court order to get a doctor in there to see her, didn't I?
Yes, it was a court order.
And when I got the court order, a doctor came in and met with Lindsay pursuant to that judge's order, and that was Paul Zeisel, correct?
I believe that's the name. I'm not sure if he was a doctor, but I believe that was the gentleman that came on the court order.
Okay, only because in your direct you said that he was not a doctor, but he was a psychiatrist. So, I mean, it's just, you knew that he had something to do with head doctor, psychiatrist, psychologist, something like that.
Correct.
Okay. Did he have to clear it with you to get into the room?
He checked in with myself and the other trooper. We were advised that he was coming and to let him in on the court order.
All right. Now, I wasn't there on that occasion, right?
No.
And when Dr. Zeisel, or whoever it was, went into the room to see her, it's your memory that he was allowed to shut the door. Is that correct?
I believe he shut the door.
Now, you were involved in this investigation pretty intensely, working with the DA's office, right?
Correct.
Isn't it fair to say that one of the contentions of the district attorneys is that Paul Zeisel, my doctor, that I got a court order to get in to see her, told her to call Pat and tell him that she heard voices?
Can I see counsel sidebar in regards to this?
Oh, this is a big deal. This is a big deal. Sidebar. Something's going on here, right? So here's the contention. The defense is saying that the prosecution is saying that the psychiatrist hired by the defense went into that room almost, shortly after the killings and told Lindsay Clancy, told her to call her husband and say that she heard voices, that there were voices in her head telling her to do it. This is a big deal, right? That's like a defense fabricating a defense, if it's true. Now, obviously, if the defense is bringing it up, they don't believe it's true, and they don't want the jury to even go there. They want this out in front of the jury so they don't sort of think, oh, what exactly did that doctor say when he was alone with Lindsay? And then Lindsay called Patrick and said, I heard voices in my head. Because remember, that's a significant part of this. This is the first time she's talking about voices in her head, is in that phone call. So let's take a look now at what happens in the courtroom. They send the jury out. So you're getting to see it, but the jury did not. Let's watch.
Dr. Zeisel, or a doctor, came in pursuant to a court order, right?
Yes.
All right. And obviously had been cleared through security and went into the room where Lindsay was laying on the bed, right?
Yes.
You don't know, or you don't recall if he closed the door or if he kept the door open or if it was half open. You just don't remember, right?
Yes.
Okay. Would you agree with me that in the course of preparing this case for trial that you have worked and collaborated with the prosecutors, the two district attorneys, correct?
Yes.
And you guys would talk about theories of the case and evidence that they want you to run down perhaps as an investigator or try to obtain, or interviews and things of that nature, right?
Yes.
And one of the theories that they had indicated to you is that Patrick Clancy had indicated to the investigators and to the grand jury, I believe, that Lindsay called him from the hospital, right?
I recall that.
And that Lindsay used that doctor's cell phone to call him from the hospital, right?
Yes.
And they basically had a theory that they wanted to run with, that Zeisel told her, Lindsay, to say that she heard voices, right?
I don't know if it's a theory or not. I just recall that conversation at some point.
Okay, so when was the conversation?
I don't recall exactly when.
You remember where the conversation was?
No.
You don't? Okay.
I'm assuming at the office. I just don't recall specifically when.
And who was it you were talking to?
Probably could have been one of the troopers in the office working the case.
One of the troopers? Is it McGilligan?
Probably. He's the case officer, so I imagine it probably would have been with him, sir.
Probably could have been him.
Yep.
How about any of the prosecutors? You talked to the DAs about that?
I don't recall specifically speaking to a prosecutor about this.
Well, how about not necessarily specifically, but do you have any memory of talking to the prosecutor about, quote, this, end quote?
No.
So what is it that your memory is that the trooper, whoever it may have been, or the investigator for the state police may have been, what did that person tell you?
That at some point when Lindsay was in the hospital with the doctor and the court order, that she made a phone call to Patrick and they discussed circumstances of the case, and then that he was interviewed later on and communicated this phone call to, I believe, Trooper McGilligan.
And what did McGilligan tell you about the conversation? What the theory or the understanding was that
during the conversation, Lindsay communicated to Patrick that she had heard voices in her head.
And there was also the conversation regarding the psychologist is basically the one that planted that idea in her head, right?
The conversation between Trooper McGilligan and I?
Yeah.
I don't recall that specifically. I just recall the facts that communicated to me that there was a phone call between Lindsay and Patrick.
Okay, you already said that. I know, and I apologize. I don't mean to cut you off, but let's cut to the chase.
Yeah.
What I'm asking you are voices. You know what that means when someone hears voices, right?
Yes.
You may not hear voices. I may not hear voices, but some people might hear voices, right?
Yeah.
That was discussed with McGilligan, wasn't it?
Yes.
And what is it that he discussed with you about Lindsay hearing voices?
That's what she had told Patrick on the phone call, that she heard voices.
And when she told Patrick that she heard that on the phone call, the prosecution determined that it was Zeisel, or whoever that doctor was, you don't recall, that told her to say that for some type of a defense, right?
I don't know what the prosecution determined. All I can say is that's what I recall, the conversation between Lindsay and Patrick.
Okay. About when
the voices.
The voices.
Yeah.
And the conversation also included the fact that it was the psychologist that planted that idea in her mind. That's the theory, isn't it?
That would be the theory, but I don't recall having
That's wait. Your answer is that would be the theory, right?
Correct.
Okay.
Agreeing with you that that's
Okay.
what was discussed.
All right.
Okay. That makes prosecutors not look so great, right? This is a theory not really based on evidence, but some circumstances, and you're presuming the worst, that the defense is making up a defense, that Lindsay's being fed a script and being told what to do to make her defense look better by calling up Patrick and saying she heard voices. It's tricky, right? Because if the jury does kind of hear this, what do they believe? Do they believe that this was a fabrication by the prosecution in making this allegation, or was this an actual fabrication of evidence by the defense? Let's take a listen now to what the jury got to hear after this hearing in front of the judge.
We're at the point where you are assisting, if you will, in the custody of Lindsay at Brigham and Women's Hospital when you observed a doctor enter into that area and ultimately into her room. Is that correct?
Yes.
All right. And the door was either closed or open or halfway, you don't recall, which is understandable, but you just don't remember if it was closed completely or open a little bit, right?
Correct.
But either way, you weren't eavesdropping or trying to hear anything, were you?
No.
And then when the doctor finished talking with Lindsay, at some point, you as investigators were aware that the doctor had allowed her to call her husband and use his cell phone to speak to her husband, correct?
I later learned that, yes.
And you later learned and knew from the investigation that it was fairly recently to that point that the tubes had been removed from her mouth and she was able to at least talk to a degree, and then she talked on the phone, correct?
Correct.
And after that, fair to say that you did not, when I say you, I mean collectively, all the police officers investigating for the DA's office, you did not see any reports or anything that would indicate what, if anything, was said between Dr. Zeisel and Lindsay in that room, right?
Correct.
And who is Sergeant, is it McElligan?
Sergeant McElligan, yes, sir.
And Sergeant McElligan, Joshua,
Yes.
he's the lead investigator in this case, is that correct?
Correct.
And at the time, he was a sergeant and you were a trooper, right?
At the time, we were both troopers.
Oh, both troopers. Okay, so you both got promoted. And he, as the lead investigator, told you in a conversation, or perhaps more than one, that the government theory is that Dr. Zeisel told Lindsay to say to her husband that she heard voices, right?
Yeah, if you could rephrase that.
Okay. Did you talk to McElligan about the theory that Dr. Zeisel is the reason that she told her husband that she heard voices?
Yes.
And do you remember where or when that conversation occurred, or how many times that you guys discussed that?
I believe it would have been at the office. I don't recall exactly when.
Okay. And there's no investigator basis for that. That's McElligan's speculation. Is that correct?
Correct.
Ooh, that's not good. That's not good. He's going to use that later in his closing argument. Trust me. That's going to be a big theme here about speculation versus evidence. Investigators and prosecutors are supposed to find the evidence, find the facts, and go wherever it leads you to, not come up with a theory based on speculation of what you think happened and then try to find the facts to fit in there. So this testimony from this trooper, this admission that this was speculation, may come back to bite the prosecution. Lindsay Clancy was seeing a lot of mental health professionals, and she was seeking help. She's trying to figure out what's going on, right? I mean, this was ongoing, day after day, week after week, month after month. And Rebecca Gelada was the nurse practitioner who testified yesterday. Letitia Dukes works with Rebecca Gelada. Rebecca Gelada is a nurse practitioner. She's sort of in charge of the medication part of the treatment. Letitia Dukes is a mental health counselor, certified mental health counselor. So she's more involved in the therapy and speaking with the patient, who in this case is Lindsay Clancy. So her perspective important as well. She's one of the people treating Lindsay Clancy in the months leading up to the killings of her 3 children. Let's take a look.
Her presenting concerns were anxiety, lack of sleep, depression symptoms, frequent passive suicidal ideation, thoughts of wanting to die and no longer be here.
And had she reported to you that she had been on a number of different medications?
Yes.
So, Ms. Dukes, on this particular visit on 12/2, what was her mood?
So she reported having low mood and feeling numb.
In regards to, on this particular first encounter on December 2nd, when it comes to the mental status exam, were you able to observe her facial expressions?
Yes.
And what were your observations of her facial expressions?
She was cheerful when discussing her anxiety symptoms.
Okay. And did you also ask those questions about thought content?
So thought content, worry about her infant, and that she had an addiction to Ativan.
And you said you also, in this assessment, assessed suicidal thoughts, correct?
Correct.
And so did you ask her anything more about those passive thoughts that you indicated she reported?
Yes, and what she reported as far as like passive thoughts were thoughts of not wanting to be here or no longer wanting to live, but no plan.
And is that significant to you, the fact that she identified there was no plan?
Yes.
And why is it significant?
Because if she identified that she in fact had a plan, then that would escalate me to see it as a crisis and request higher level of support at that time.
And as far as her expressed concern to you, fair to say it was focused on the one particular medication, the medication Ativan, correct?
Yes.
And why did you not find that to be an issue based on your assessment?
Based on my assessment and how she stated she was supposed to be using it, it was used correctly to remedy the anxiety symptoms.
Sure. In that visit on December 5th, did she indicate to you or did she report to you how the weekend went for her?
Yes, she did.
And what did she say about the weekend?
She reported that over the weekend she had a difficult weekend, having intrusive thoughts about wanting to die, and that she had contacted Aspire Crisis Support. She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to having no SI plan, suicidal ideation plan. So support during this meeting, I offered her support in connecting to, it seemed like she needed a higher level of care, so intensive outpatient therapy, partial hospitalization therapy, as well as we reviewed, one of her main concerns was also issues with sleeping, so we reviewed sleep hygiene and how to support better sleep to see if that would help with some of the intrusive thoughts.
Okay. And as far as the recommendation for intensive outpatient or partial hospitalization, did she want to connect with those programs at that time?
At that time, she didn't decline services, but she was interested in the information.
Okay, and so did you agree to send her some information?
At that time, I did not agree to send her information.
Okay. Did she ask for any other information in that meeting?
She did ask for information and support connecting to psychological testing.
And is that something that you do at your clinic, do psychological testing?
Yes.
Okay. And so did you make a referral for her to see somebody else in the clinic, or did you provide her other information?
So I discussed this information with the provider at the time, which was the psychiatrist and medication provider at the time.
And would that have been Rebecca Gelada?
Yes.
And so did you subsequently send Lindsay Clancy some information about psychological testing?
Yes.
But there was no recommendation for it to be done at the clinic?
No.
Do you know why?
At the time, it sounded like she wanted extra support or like outside opinion as far as like diagnosis and medication.
Okay. And why did you recommend women and infants, or why were you recommending this higher level of care?
I was recommending this higher level of care because of continued passive suicidal ideation, even with crisis intervention, as well as women and infants was more so for postpartum women, and the infant would be able to come to the program with her.
And so did you work to make that referral after that visit?
Yes.
Now, you mentioned that she had continued passive suicidal ideation. In this meeting that you had with her, did you assess that? Her suicidal ideation?
In this visit particularly, did she have passive suicidal ideation?
Well, do you ask if they still have that?
Yes.
Or if they currently have thoughts of suicide?
Yes.
And in this instance, did she have thoughts of suicide or wanting to die?
Just reviewing, hold on. So yes, she reported continued suicidal ideation at the time.
But did she ever indicate a plan?
No.
Having met with her on the 12th, did she ever articulate to you that she had made any attempts?
No.
And in your conversation with her on the 12th, were you able to identify any protective factors based on everything that you knew about her at this time? Now, this is your third time with her, right?
Yes.
So what were you able to identify as protective factors for this particular patient?
At this time, she had supports, which were her husband and her mother-in-law. At this time, she was able to, from the past visit I had with her, able to contact crisis when she felt like she needed extra support. So she was able to follow through with suggestions that I had given her in the previous visit.
Okay. And based on your visit with her on the 12th, she accepted a willingness to go to one of those programs, right?
Yes.
Or at least be referred.
Yes.
So on this particular visit on the December 19th, did she report any further issues or anything that had happened between the 12th and the 19th that were of concern?
So she was continuing to have low mood and numbness. She did not have any SI and had no need for crisis intervention over that weekend.
Okay. And did she indicate to you that she had been doing things at home to try to help with her mood?
Yes.
And what was she doing?
Let's see. She was spending time with family and her children and exercising.
Here's the problem, and this is a big picture problem that prosecutors have. This is the prosecution case. This is someone alleging a mental disease or defect that has the most documented history I've ever seen in my years at Court TV. When it's time for the defense to go, they'll call their own witnesses and bring on some experts, etc. But in this case, as in every case, a big part of the defense is the cross-examination of the prosecution witnesses, and specifically in this case, the cross-examination of the treating health professionals is so important. So let's watch the cross-examination of Letitia Dukes, the licensed mental health counselor.
For you to diagnose a woman, whether she's pregnant, has the baby, or after having the baby, with postpartum depression, there are certain things that are symptoms that you look for, right?
Correct.
Okay. One of which would be depressed or sad mood, right?
Yes.
Lindsay had that, right?
Yes.
Next would be tearfulness, right?
Yes.
Lindsay had that, right?
Correct.
Next one would be loss of interest in social activities or usual activities or friends. She had that, right?
Correct.
Feelings of guilt. She had that, right?
She didn't express feelings of guilt.
Okay. Feelings of worthlessness. Did she express that she felt worthless?
She did not express that.
How about fatigue? Did she have that?
She did not express fatigue, but lack of sleep.
I know lack of sleep. Were you aware that, in fact, that she had indicated that she was so wiped out that she couldn't even get out of bed, couldn't put her feet on the ground, and if she did, she felt heavy?
I did not hear that from her.
Okay. How about, you mentioned it, you got it, sleep disturbance is another issue, correct?
Correct.
She had that, right?
Yes.
Change in appetite, she had that, lost 10, 15 pounds, right?
Yes.
Poor concentration. She had that, right? She said she was numb. She could not focus. Suicidal thoughts.
Yes.
We know she didn't have a plan, but she had suicidal thoughts, right?
Correct.
So under the Mass General Hospital research project for women that are suffering from postpartum issues, she pretty much hit every one of the postpartum depression symptoms, correct?
Correct.
And then it talks about if it increases in severity, significant anxiety symptoms may occur. Not generalized anxiety. Significant anxiety symptoms can occur. Is that right?
Correct.
And one of the ways that you determine that is by the test that it can be administered to a person who is in a postpartum status, and that would be what we talked about, the Edinburgh test, right?
Correct.
And you're aware that she was given the Edinburgh test and had a 23 out of 30, I think it was.
I was not aware.
Okay. And some women develop panic attacks referred to as hypochondriasis. You'd agree with that, right?
Agree with that in reference to.
Lindsay, she had panic attacks and complained of having panic attacks.
Yes.
Okay. And then you can get into the various diagnoses of which, on a postpartum person in that time frame, obsessive compulsive disorder, OCD, right?
Correct.
Or bipolar 1 or bipolar 2, right?
Are you using them interchangeably or could develop?
Trust me, let's say bipolar 1,
Yeah.
okay? So that would be one mental disease, correct?
Correct.
And it's pretty serious stuff, right?
Yes.
And if a person is diagnosed as bipolar, one of the things that you shouldn't, if you know, is prescribe SSRIs such as Prozac or Zoloft, right? If you know.
I'm not sure of that.
Okay. Would you agree that with various cases dealing with postpartum depression, all of the symptoms that we talked about, they utilize the Edinburgh Postnatal Depression Scale, which is a 10-item questionnaire that can identify women that have postpartum depression and the severity that they have. And on the scale, a score of 12 or greater it raises concern and indicates a need for more thorough evaluation, right?
Correct.
Do you know whether she was thoroughly evaluated by anybody other than Tufts and Gelada?
I'm only aware of Tufts and Gelada.
Okay. I mean, you were trying to do the best you could with what you had to work with, right?
Correct.
Okay. Now we get to postpartum psychosis. That's the third category, right? Postpartum psychosis, you'd agree, is the most severe form of postpartum psychiatric illness. Is that right?
Correct.
Would you agree that it occurs in averages about 2 out of 1,000 women, right?
Correct.
And its presentation can be very dramatic with onset of symptoms, and that can be within a year, according to the CDC, Center for Disease Control,
Yes.
right? Okay. And when it hits you, it just hits you, bang, quick, right?
Correct.
And when you think about 2 out of 1,000 people, seems like a daunting number, but if I tell you that Fenway Park, when they're full, when they're playing the Yankees, they have 37,700 people. If you take the 37,000 people and you multiply it by 2, that would mean as you're sitting there behind first base, 74 women possibly have postpartum psychosis, right?
Not sure of that number, but.
Well, if you agree that it's 2 out of 1,000 according to the studies and the statistics, and if Fenway Park has 37,000 seats, times 2 would be 74.
Okay.
That's a pretty large number of people, right? 74 people out of that crowd? Okay. It's not that horribly unusual. I mean, it's something that perhaps you've dealt with in your practice, right?
Yes.
And when you're dealing with people with postpartum psychosis, do you agree that generally they present with an episode of bipolar illness? If you know.
No.
No, they don't, or no, you don't know?
No, I don't know.
Okay. bottom line is, from your dealing with Lindsay, she appeared to be sincere, right?
Correct.
She appeared to be looking for help, right?
Correct.
She appeared to be hurting, right?
Yes.
Turning in every direction she could for help, right?
Correct.
And the last time you saw her was when?
December 19th.
And that, once again, is the problem for prosecutors here. Like, these are the facts. She was struggling. This is not someone who is alleging a mental defense who had no history of it. It is well documented, and witness after witness has been testifying about it. And what prosecutors are trying to do is minimize it, whereas the defense just wants it all to flow in front of this jury. Wow.
I discussed with her and her husband the possibility of potentially an underlying bipolar disorder.
That is huge. That's a huge part of this trial. That is Rebecca Gelada. She's a nurse practitioner who treated Lindsay Clancy up until December of 2022. So she is suspecting that she's suffering from potentially a bipolar disorder. When she told that to Lindsay and Patrick Clancy, they were like, no, that's not what's going on here. And they sort of fought that diagnosis. But she's really the first one that we've heard in the trial talk about this, other than the defense attorney, Kevin Reddington, who part of his contention in his opening statement was she was misdiagnosed. She was bipolar, and they're giving her this medicine that makes it worse. Medicine for depression that makes the bipolar worse. And here's a nurse practitioner who is suspecting, well, maybe she is bipolar. So we're going to watch now the cross-examination of Rebecca Gelada. But the reality of what's happening here in this relationship between health provider and patient is that the patient is hesitant towards this acknowledgement of potentially being bipolar at the time, but now at trial, it becomes part of her defense. So let's watch this extremely important cross-examination.
So you knew that she had been reporting panic symptoms, that she was disoriented, that she was forgetful, that she was not connected to her body? This is what she told her, right?
I would have to review that just to be accurate. That's correct.
Okay. Symptomology of mania, especially when incurred or encountered by a woman within the postpartum period, that's one of the symptoms, is being disoriented, right?
Not necessarily.
How about maybe a little bit?
Could be confused if you're manic.
Yeah. How about forgetful? That's an issue, isn't it?
Not necessarily a symptom of mania.
Okay. How about not connected to her body? What does that mean?
I'm not sure what that means.
So if you have a patient who's coming to see you, who's indicated the day before that she has the panic symptoms, disoriented, forgetful, not connected to her body, wouldn't you ask her what she meant by that?
Yes.
Okay. So when you saw her on November 29th, you diagnosed that she had postpartum anxiety, right?
Mm-hmm.
Adjustment insomnia, right?
Correct.
And when you met with her, you noted that over the last 2 weeks, you asked her about how she had been feeling, and she said she was feeling nervous, anxious, and on edge, and she said nearly every day, right? That's November 29th. That would be under screenings.
Yes, she was.
I would give you a page number, but they don't give us page numbers. She told you, and you can pull it up if you have it there, that she was not able to stop or control worrying, and that had been for several days at least, right?
Correct.
And she was worrying and stressing about things, worrying about different things every day, right?
Nearly every day, yes.
Couldn't relax nearly every day. This is a questionnaire form that you have, right?
Yes.
Being so restless nearly every day, correct?
Correct.
Asked if she was annoyed or irritable, and she said not at all, sure, like she didn't believe that she was a person that would be irritable or angry with people, right?
Yes.
And then feeling afraid as if something awful might happen, and she got that GAD 7 score of 14. Is that correct?
Correct.
So what does a GAD score of 14 tell you on November 29th?
Moderate anxiety.
And then you ask about in the last 7 days, trying to get a history. She denied, definitely not so much now, that she was able to laugh or see the funny side of things, right?
Right.
And that she was asked, is she looking forward with enjoyment to things? And she responded, hardly at all, right?
Yes.
Blaming herself when things go wrong, she says, yeah, some of the time. Yep.
Yes.
Anxious and worried for no good reason, yes, correct?
Yes.
Scared and panicky for no good reason, yes, correct?
Yes.
Then they asked if she felt sad or miserable, if she was a miserable person, and she said, no, not at all, right?
Right.
And basically you indicated that you were going to send along information about bipolar 1 or bipolar 2, which actually would be what's known as a bipolar spectrum disorder, is that correct?
Yes, that was on December 7th.
Okay, but it's underneath November 30th, so forgive me for looking at it that way.
Yeah, I don't know why I printed
That's all right,
it.
no problem. So one of the things with the mania that you refer to and that you talk about is excessive activity, is that it? Excessive cleaning sometimes, right?
Sometimes.
Excessive exercise?
Sometimes.
Did you know that after she had Callan, that within a matter of a couple of weeks, that she ran a 5K?
No, I did not know that.
And that nobody wanted her to, including Pat, but she just had to get out there and run, and did.
Objection.
Overruled.
You know that?
I did not.
Is that something that would be important to know? I mean, as far as whether or not a person is in that manic stage where it's post-delivery, and that's a significant artifact, if you will, of exercising, right?
It would have been something I would have considered.
Okay. And as I said, you were pretty much the only one that actually considered bipolar spectrum disorder of all the doctors that she had seen. You know that, right? Are you aware of that? All right, never mind. That's right. She's going to object. That's okay.
Okay.
So the symptoms that you noted were mania. It says mania characterized by exaggerated excitement, hyperactivity, and racing scattered thoughts, right?
Yeah.
So what is, go ahead.
Was that from my note?
I'm looking at the same thing that we've been looking at, which is...
Oh, the information I sent her on bipolar.
Yeah, it says,
yes.
Hi, Lindsay, and then your note. If you move ahead to, I think, the message portal or whatever it's called, on November 30th, it's captioned, Stopping Remeron.
Yes.
And it's, okay, you're with me. And it says, no, this would go to the fact that she was still not sleeping. It was a huge problem for her, right?
Yes.
And she told you in her message thing, no, the weird thing is I don't feel tired at all.
Correct.
And that's one of the things that you had told us earlier is a symptom, correct?
Correct.
A person that is not getting sleep but doesn't feel tired.
Correct.
What is a symptom of?
It's a symptom of mania that we look for.
Okay. And when we looked for that mania, did you notice that? And did you factor that into your diagnoses?
Yes.
Okay.
It's fascinating watching this dynamic because this testimony is playing into the defense. And we've been talking about that for a couple of days. But at the same time, in their civil lawsuit, Lindsay and Patrick Clancy are suing nurse practitioner Rebecca Gelada, who was the one who seems to be the only one who recognized this alleged bipolar disorder. We'll see what the jury does in the criminal case with this testimony. Significant, important. That's it for now. We're out of time. I'm Vinny Politan. Thank you so much for watching. And as always, please don't forget to hug the kids. That's Lindsay Clancy, a triple murder defendant breaking down in the courtroom as she listens to the medical examiner describe the injuries to one of the victims, her 5-year-old daughter, Cora. Lindsay admits that she killed Cora and her 2 little brothers, but does not believe she should be held criminally responsible.
You also, a week later, wrote a script for diazepam. December 6th, you wrote a script for diazepam 5 milligrams. December 7th, you wrote a script for diazepam 5 milligrams. December 7th, again, you wrote a script for quietapine
Prosecutors concede that Lindsay was suffering from some level of mental illness, but they say she knew what she was doing when she allegedly planned the murders of her children. The foundation of the prosecution case is that Lindsay sent her husband out to pick up some food from a local restaurant to give herself time to kill her 3 children. It's the biggest trial in the nation, a case where the jury must decide if Lindsay Clancy is a calculated killer or the victim of mental illness. I told you this was going to happen. This is the trial now that everyone is talking about, and it's because of the issues at stake here. We're talking about the brutal, violent killing of 3 innocent children. But on the other hand, you have a mother who was suffering from mental illness. And this jury of 12 people coming inside a courtroom have to decide whether or not Lindsay Clancy should go to prison for the rest of her life or get help at a mental health facility. I'm Vinnie Politan. Let's investigate. As we get closer to the end of this prosecution case, we've seen a lot of different types of evidence, but this case is not a whodunit, right? This isn't the type of case where this jury has to figure out who is responsible for the death or the deaths of the 3 children. Lindsay Clancy did it. Like, both sides are admitting that, conceding that, alleging that. There's no disagreement. Lindsay Clancy is the one who took those exercise bands and put them around the necks of the 3 children and took their lives. Now, what the jury has heard and seen probably is the biggest fact witness, Patrick Clancy, because this is someone who is living with Lindsay day to day. He's the father of the victims. He's the now ex-husband, but was the husband of the defendant at the time. He is there before and after all of this happened. He is providing more facts about who was where and how she was acting, where he went, what he saw, than anyone else in this case, and is a very significant fact witness. Now, the other witnesses who are really important in this case are the treating professionals, the nurse practitioner and the psychiatrist, Dr. Tufts, nurse Rebecca Gelada, who were treating Lindsay Clancy and gave this jury some insight into what they were seeing, what they were hearing from Lindsay, what their observations were, what their diagnoses were. And that's a big part of this case, obviously. So you've got the facts, you've got the treating physicians, but now this next bit of evidence could be as important as any evidence. And I'm talking about the cell phone evidence in this case from Lindsay Clancy's cell phone. Taking this jury inside the mind of the killer to try to help figure out if she's a murderer or someone who was mentally ill, who is not in control of her actions. That her illness and the medication has taken over her mind, her process, her actions. So let's go inside the courtroom. Timothy Ciappini, Massachusetts State Police, on the stand talking about what they found and what they allege Lindsay Clancy was doing on her cell phone in the moments, days, and hours before the 3 children were killed. Let's take a look.
So just for the jurors looking at this report, here in the metadata, capture time is when the photo was taken. Above it, the 1/23/23, that's the date that the picture was changed in some way?
Yes.
So a live photo is one of those photos that's taken, and you see a little movement before it settles into the photo when you look at it?
Yes, ma'am.
And is that an automatic setting on iPhones that it's set to live and you have to change it if you don't want that feature?
That's correct.
And so if you modify the photo and save that photo, that modified photo is not live?
Correct.
And is that what you saw here? There were a lot of photographs of the children that were accessed and modified in some way?
Yes.
And during what time frame were these photographs accessed and changed?
During the evening hours of January 23rd, 2023.
And what is this report displaying?
This is another timeline report with the first event starting January 24th, 2023 at 4:00 p.m.
And does it go on January 24th, 2023? from 4 p.m. to 8 p.m.?
That's correct. It encompasses everything that would be before that time frame. It appears the last entry is 7:02:01 p.m.
And this would contain all of the things that were done with the phone between 4 and 8 p.m. on January 24th, 2023. Is that correct?
Everything that was detected by the forensic tool based on the extraction type.
Okay. And if we could go to the time frame 4:30 to 4:35. Using the tool, we'll search Miralax. Looking here, starting at item 37 at 4:46 p.m., is there a search for Miralax for kids on the phone?
Yes.
And again, we're seeing the search for Miralax for kids, 4:46:55, 4:46:55, the same time over and over again. Is that another example of one search showing up in multiple categories?
Correct. As an examiner, I would be looking at the timestamp and also the category second box in from the left, indicating that the Celebrate software has parsed it in multiple locations.
So we see here at 4:43 p.m. on January 24th, a search for the 3V menu, correct?
Yes.
If we could scroll down a little. And again, those are all at the same time, so they indicate one search for the menu?
Yes, and the tools parsed it in multiple categories.
And if we could go back. Was there also a search for an Apple Maps for 3V?
Yes.
And what time was that?
Sorry, there's a glare.
And here in Apple Maps, do we see 3V restaurant at 4:13 p.m.?
Yes.
And when you're using a map feature to look up a location, such as Apple Maps, what type of information do you learn when you plug in a location or an address into Apple Maps?
A route preview.
And does that route preview give you a length of time it would take to travel to that location?
Depending on what you indicate as your originating location, yes.
And so if you plug in 3V restaurant to Apple Maps and it maps out a route to get there, does it tell you from your location to 3V how long it would take to get there?
Based on traffic conditions, yes.
Because that changes constantly, correct?
Yes.
So if I open up my Apple Maps and I put in 3V right now from here, at this time, the time it takes to get there might be different than, say, at 6 o'clock tonight.
Yes.
And so if we can go to 4:47 p.m. And here at 4:47 p.m., again, we're seeing the search for Kids Miralax, correct?
Yes.
Is there also a visit to a CVS website here at 4:47:04?
Yes, it's categorized in multiple categories within the tool, but it parsed an artifact at that time.
If you could scroll down a little, please, to the phone call, the next phone call, right here. This outgoing phone call at 4:48:21 to 781-585-6581. Did you learn that that was a phone call to the CVS at 189 Summer Street in Kingston?
Yes.
And so that would be an outgoing phone call from the defendant's phone to CVS.
Yes.
Can we go to 4:53 p.m., please? And then there's a message. It says message 80, outgoing from the defendant's phone at 4:53:09 from Lindsay to Patrick Clancy, correct?
Yes.
And it says, any chance you want to do takeout from 3V? I didn't cook anything. It's been a long day, correct?
That's the content of the message.
Is there a response in message 82 from Patrick to Lindsay?
Yes, there is.
And what is the answer?
Yeah.
And then is there a response from Lindsay to Patrick at message 84?
Yes.
And what is that?
Okie dokie.
And then message 86, again from Lindsay to Patrick, does she send him another message?
She does.
And what does that say?
Check the menu when you can.
And then if you could scroll down to the next message, is that message 90 from Patrick to Lindsay asking if Callan just got up.
It is.
And then message number 92, is that from Patrick to Lindsay saying also, what are you getting?
Yes.
And then 94 at 5:06 p.m., is that from Lindsay to Patrick stating, but it was just a short nap in message 96.
Yes.
And then message 97 at 5:06 is 3D menu searched.
Yes.
And that source says Safari. Is that a Safari web search for the 3D menu?
Safari is the default web browser on an iOS device, and iOS stands for iPhone operating system.
So that's a basic search on your iPhone for the 3D menu.
Utilizing the Safari web application, correct.
And then number 98, is that another search for Pedialyte?
Correct.
Excuse me. Now, both the search for 3D menu and the search for Pedialyte are at 5:06:45. How does that happen, that there are two searches for two different things at the same time?
Can you repeat the question?
So you have in message 97, you have on January 24th, 2023 at 5:06:45, a search for 3D menu. Then the same date at the same time, a search for Pedialyte.
And what's the question?
How does it happen that you have two searches at the same time?
I would only be able to make an inference from here without having the forensic tool available to me.
And what would the inference be?
That there was more than one tab open.
Okay, so on your phone or a computer, when you're doing web searches, you can have multiple pages open, correct?
Yes.
And you can just click on whatever page you want to open, you can click on and that will open up.
Correct. You can select which tab you want within the Safari application.
Tabs, right? Okay. So how many tabs can you have open at any one time?
I'm not sure the number, but I've seen iOS devices capable of having more than 30 or 40 tabs open at a time.
So it wouldn't be uncommon or unusual to have at least two open to two different web searches?
No.
Okay. If we could scroll down a little, please. And then we have in 106 and 105, both messages. First 105, we have a web history at 5:06:47, the menu at 3V restaurant, again, the source Safari. And then we have cookies at 5:06:48.3vrestaurant.com. Can you tell us what the difference between those two are?
They're both from different databases. They're both associated with web browsing. Web history is from the history component of the Safari application. Cookies are installed through web browsing. Through legislation, when you visit a website for the first time, you'll typically be prompted, do you want to allow the website to download cookies onto your device? Cookies downloaded on your device serve a multitude of reasons. One might be that it allows the website or the company to be able to track your activity while on their website, which helps them for marketing and business purposes. Another component of cookies would be to enhance the web browsing experience for a website you go to on a regular basis. It would increase the load time. So it is an artifact that is indicative of web browsing.
have at 5:06:49, we have a message from Patrick to Lindsay saying, "Oh, okay." Is that correct?
Yes.
And then message 1:12, we have a message from Lindsay to Patrick where she says Mediterranean Power Bowl, correct?
Yes.
And that was at 5:07 p.m. We have a message 1:15 from Patrick to Lindsay at 5:08 p.m. Okay, I'll do scallop and pork belly risotto. Is that right?
Yes.
All right. And then if we could go to 5:10 p.m., the phone call right there. Oh, go back to it. And so we have two phone calls here, one at 5:09 p.m. and one at 5:10 p.m. The first to 508-747-4950 and the other to 508-927-4046. The first one is for 11 seconds, correct?
That's the duration, yes.
And that's noted here above source?
Yes.
And then the second is 47 seconds, is that correct?
Correct.
Did you look into these two phone calls?
I don't recall.
Okay. Do you recall the 508-927-4046 being the number for the 3V restaurant?
Yes.
And if we could scroll down a little bit. Are there further searches at 5:13 p.m., starting at number 128 for Pedialax?
That's correct.
And again, we're seeing that same thing with the same time, but multiple different categories that one search is located in, correct?
Correct. Single artifact, multiple categories that the tool parsed it as.
Can we go to 5:33 p.m., please? Oh, I'm sorry. I stopped there. Thank you. 146, message 146, a message from Lindsay to Patrick at 5:15 p.m., which states Pedialex liquid stool softener, correct?
Yes.
Right. And then at 147, we have 5:33:51 p.m. Is that a phone call from Patrick's phone to Lindsay's phone?
Yes.
And that has zeros in it for duration. Does that indicate the call wasn't answered?
It would be an inference.
And then going down to 150, we have an outgoing call from the defendant's phone to Patrick Clancy for 14 seconds at 5:34 p.m., correct?
Yes.
That means the call lasted approximately 14 seconds.
Correct.
And then the last item there, item 152, that is an incoming call to the defendant's phone from Patrick Clancy, correct?
Yes.
And again, we have zeros here indicating that the call wasn't answered, correct?
It's an inference, yes.
What is the jury learning here? I mean, if you listen to this testimony, it seems like it's very ordinary communications and searches, etc. But for prosecutors, they say this is the foundation of the premeditation, that all of this was set up by Lindsay Clancy. Send him out on those errands to give her time to kill the children.
The items shown here on the screen are all associated with web browsing.
And here where we see 10773 and 10774, and they both state, can you treat a sociopath?
Can you treat a sociopath? An actual search done by Lindsay Clancy. Sociopath. Not someone who's psychotic, not someone who's delusional, not someone who is bipolar, but a sociopath. And we've covered our share of sociopaths here on Court TV. What will the jury do with that? Is that an acknowledgement of what's going on in her head and who she thinks she is or who she knows she is? Powerful piece of evidence coming out, again, from the searches of Lindsay Clancy. This is an opportunity for the jury to get inside of her mind, her train of thought. What is she thinking about? What is she searching for? So I don't want to leave it there, though, because she did search a lot of things, a lot of other things. So on cross-examination, her attorney, Kevin Reddington, bringing out some of these other searches done by Lindsay Clancy. Once again, taking us inside the mind of the killer, the accused murderer. Let's take a look.
Are you aware that there were searches for medical, such as questions regarding bipolar symptoms, psychosis? Can you be in DKA without high blood sugar? Page after page after page, trazodone, what is the effect of trazodone, Wellbutrin, how do you feel on trazodone, Ativan, addiction, Prozac, Trazone, going on and on and on. You guys saw this on her search on her phone, the Celebrate, right?
I recall those searches, sir.
Do you recall, sir, that there was also a search for schizophrenia? I'll say that.
Not specifically.
Well, if I approach you, sir, and your extraction book.
Yes, sir.
Okay, what was the date of that search?
January 19th, 2023, 9:58:01 seconds a.m.
Okay. Put that right here for a minute. How about psychosis? Did she search for psychosis as well?
If I may.
Of course.
There is a keyword search in psychosis in a Google search.
And that would be a keyword search that you said in a Google search on the January 20th?
January 20th, 2023, 8:39 and 0 seconds p.m.
Is there also a search for Seroquel?
Seroquel is part of a search, yes.
And what was the rest of the search?
On Seroquel, feel like I can't have a conversation.
Okay. Can you tell us when she was Googling suicide?
December 29th, 2022, 1:02, 14 seconds p.m.
She also Googled on a number of occasions sleep.
Sleep is one keyword and part of a Google search, correct?
And then there's a number of pages that are attached to that dealing with the search for sleep, correct?
That's correct, sir.
And do you know the time frame that we're talking about from the Celebrate search?
Multiple entries, sir. Majority of them are in January of 2023.
Okay. Also, a much larger package of searches for trazodone. Is that correct?
Yes, sir. Trazodone is one keyword as part of multiple Google searches.
Okay. Zoloft.
Correct.
What's the time frame?
If I may just remove this, sir.
Yeah, sure.
Earliest entry is December 31st, 2022, 4:07, 48 seconds p.m. Last entry, all on the same date, December 31st, 2022, 7:06, 39 seconds p.m.
Okay. She also, on her phone, is a search for benzo withdrawals, right?
Yes, sir. Benzo is listed as a keyword as part of another search.
Also, after benzo, it says withdrawals, right?
Correct.
And what's the time frame for that, please?
January 20th, 2023, 8:11, 57 seconds p.m.
Okay. And also a search for Wellbutrin.
Yes, sir. Wellbutrin is a keyword as part of a Google search.
Does it say what the time frame is?
It does.
What is it?
January 16th, 2023, 9:14, 47 seconds a.m.
Okay. And a search for McLean.
Correct, sir. McLean is part of a keyword of a Google search.
What's the time frame?
December 29th, 2022, 8:52, 37 seconds a.m.
Is there also a search for insomnia?
Yes, sir. Insomnia is part of a keyword of a Google search.
What's the time frame?
December 31st, 2022, 7:12, 58 seconds p.m.
That's December 21st, did you say? 31st.
December 31st, 2022, sir.
And there a search for keyword ketamine, K-E-T-A-M-I-N-E.
Yes, sir. Ketamine is part of a Google search. It's a keyword within the Google search.
What's the time frame?
For this entry, January 20th, 2023, 8:39, 0 seconds p.m.
There's also a search pulled up on Celebrate for Lamictal.
Yes, the word Lamictal was part of a Google search.
And what's the time frame?
January 16th, 2023, 9:23, 13 seconds a.m.
Okay. Was there also a keyword search for postpartum and Google searches for postpartum depression and various aspects of postpartum?
Yes, sir.
And what's the time frame for us?
They all occur within January of 2023, with the earliest date being the 11th of January 2023 and proceeding all the way to the 19th of January 2023.
And search for bipolar. That was on her phone?
Keyword bipolar is part of a Google search, correct?
Bracketed in. What's the time that it started? When did it end?
The earliest entry is from this report is December 29th, 2022, 9 a.m., 37 seconds. And the last entry is January 13th, 2023, 1:38, 42 seconds p.m.
And clonazepam was a search as well, correct?
That's correct, sir.
And can you just give me an idea, what's the time frame on that?
All of the searches in this report indicate January 18th, 2023, in the morning hours from 11:26 a.m. to 11:27 a.m.
Okay. And the next one would be Ativan. You see where it says Ativan? What's the first? Just give me the first month. What's the stat? Search for Ativan.
The earliest time frame, sir? December 31st, 2022, 7:06, 30 seconds p.m.
Okay. Next one would be amitriptyline, correct?
I'm not sure on the pronunciation, but it appears to be that way.
Okay. And when was the amitriptyline search? When did it start? When did it end?
January 16th, 2023, 11:01, 28 seconds a.m., with the last entry being January 23rd, 2023, 8:17, 58 seconds p.m.
And then on January 20th, 2023, was she searching intrusive?
That's correct.
Okay. And then finally, sir, on January 19th of 2023, was she searching hallucinations?
Yes, sir. 10:33, 49 seconds a.m.
Okay. What's the takeaway from all of that, right? What's the takeaway? What's the image? What's the picture that's in your mind? I know the image that's in my mind because I've been there. There's something wrong. You know there's something wrong with you, and you are desperately, desperately looking for an answer. That helps the defense. Prosecutors don't have to prove motive. We hear that phrase all the time, and then it's always followed by, yeah, but in this case. Well, I'm going to say, yeah, but in this case, because if you look at what's happening here, this trial is about the why of it. It really is. And the defense is saying the why is very obvious. It's the mental illness. It's the bad diagnosis. It's the over-medication. That's why she did it. So prosecutors need to address the issue. I'm sorry. It's not an element of the crime, but you need to address it to attempt to disprove that the mental illness is what did it. To disprove that it was the medication or the over-medication that did it. So let's take a listen to this part of the testimony from the lead investigator talking about some journal entries. And this, again, it takes us into the mind, the thinking, the mens rea of the defendant, Lindsay Clancy. Let's take a look.
This area here, this separate report, is this the notes that were found on Ms. Clancy's phone?
That's correct.
And if we could zoom in on that, please. And there's basically detailed in journal form, correct?
Yes.
Starting October 24th, 2022, and moving down, correct? And if we could just scroll down to the October 25th entry. And I would just like you to read this portion of the note. I would read it, I'm sorry, but I'm having some difficulty.
I'm sad and depressed because I am not able to parent my third child like my first. I want to treat any one of my babies like my first, but I know that's not a feasible possibility. I'm sad that I stopped breastfeeding. I feel not as connected with Cal now. I think I sort of resent my other children because they prevent me from treating Cal like my first baby, and I know that's not fair to them. I know that. I was feeling so depressed last evening when Cora and Dawson came home from school. I know it runs off on them, so we had a pretty rough evening. I want to feel love and connection with all my kids. I'm also probably having a bit of an internal conflict because my whole life I wanted to have a lot of kids. I still don't want Cal to be our last, but I have a lot of figuring out to do before I have another. I'm on the fence about starting a new medication for anxiety/depression. I just want to feel happy. I want to be able to relax and take care of my kids. And when they go to bed at night, I want to deeply relax and hang out with Pat and then fall into a deep sleep for 8 hours, get up, and pour hard into myself for an hour and a half. Cal was so very planned and desired. I want to be able to give him all the love he deserves. I guess that's what it's like to be the third child, though. He's not the first third child to ever exist. I think I know he'll be okay, but it's really hard for me. I hate that he has to put himself to sleep. I'm sad I'm not breastfeeding anymore, but I think deep down these are the right choices.
If you could continue.
As for the sleep training, I needed a baby that slept through the night because I simply do not have the opportunity in my life to catch up on sleep. I just don't. If there was a time for me to nap every day, then that may not have been the case, but there really isn't. When Cal naps, I have to take care of Cora and Dawson. That's just how it is. It feels cruel to me that we did not do that to Cal, but the reality is we did what we had to do. I guess I also feel slightly traumatized by the sleep training, but that feeling was only really present when I was severely sleep deprived and paranoid. I know what we did was the right thing and okay. As for the breastfeeding, it kind of goes hand in hand with the sleep training. Once he started sleeping most of the night, it was then a daily struggle to keep up my milk supply. I was having to take a ton of supplements and constantly think about eating and drinking enough to keep the supply up, and then I was having to think about pumping extra to keep it up, and that was really hard to do with Cora and Dawson around. When I tried to leave Cal to go out with Cora and Dawson, I was stressed about the pumping, and not to mention the fact that Cal was at home and not taking a bottle, so it was a battle of if I should pump or not. I know I did the right thing because I need to be able to leave Cal with someone and get fed. As much as I don't want to leave him, I need to be able to. I need to be able to be present with my other kids. I still really, really want a fourth child, but I need a really good therapist before then. I'm on the fence about starting a new med or not. I want to feel happy, but it would be nice to feel authentically happy and not fake. But I need to feel happier than I did last evening because then I was pretty depressed and not enjoying any of my children. It was really sad. I needed the breastfeeding off of my plate. I'm struggling so hard because I wanted to parent each of my kids like my first, and since I can't, that's depressing to me. This is definitely the root cause of all our problems. Now I feel like I'm not parenting any of my kids the way I want to, and that makes me sad too. But I'm going to try my best today. Things I love doing that help me love and appreciate and enjoy my kids are activities with them. I definitely started having some depression after Cora, but once I started getting up and out with her, I felt much better. I think signing Cal up for baby music class would be a great thing. Maybe Fridays can be my day with him. I've just fallen out of the habit of doing anything fun, anything for myself, anything with Pat, and I need to work on that. On a positive note, I had a great deep night of sleep. I'm terrified of something happening to my kids or doing something wrong to mess up their development. Our generation is inundated with information about every aspect of parenting and everything that go wrong if you don't get it right. And all the scary things happening in the world. It's insane. For the last 5 years, I've just filled my mind with all things parenting, and it's just unhealthy.
Thank you. And so everything that you just read would have been written and filled in by the user, correct?
Correct.
It's sad, isn't it? But it takes us inside of her mind. I mean, but what does this mean? Does this mean that she just didn't want to be a parent anymore? I can't take it. I'm going to get rid of all of them because I can't get a good night's sleep. Is that really what's going on here? Or is that her in her journal writing, trying to work through this depression that has set upon her, this postpartum depression that the defense says then transitioned into a psychosis? This is not an easy case. This is an incredibly sad and tragic case. There have been a lot of dramatic moments inside the courtroom during the trial of Lindsay Clancy. Some of it has been heart-wrenching. Some of it has been very, very difficult for everyone involved. But the moment when the medical examiner was testifying about the injuries to Lindsay's 5-year-old daughter, Cora, Lindsay Clancy lost it. Judge had to stop everything, clear the courtroom, and restore some sense of order and decorum inside that courtroom. But the real question here on this issue of the jury seeing this and hearing this the way we heard it through the microphones that were nowhere near Lindsay Clancy in the courtroom is that what does the jury do with this information? Do they feel any level of sympathy for Lindsay Clancy? Does she look like someone who is showing absolute remorse and disbelief in what she did as a result of mental illness? Or do the sympathies that the jury's feeling at this moment go to the daughter Cora, the one who suffered, the one who was strangled to death by her own mother? This is a crucial moment, despite the fact that it's focused on something that's happening in the courtroom that is not from the witness stand. It's from the defendant's table as she sits there in her wheelchair. So I'm going to show you that moment, but I want you to think about what's the takeaway for the 12 people who must decide what to do with Lindsay Clancy. Let's take a look.
And did you perform an autopsy on Cora Clancy on January 25th, 2023?
Yes.
And did you follow that same process with Cora Clancy?
Yes.
And so that started with a document review, is that correct?
Yes.
And what type of documents are you reviewing when you do that?
Typically, I have a preliminary police report to review, as well as either EMS records or records from the emergency department.
And did you start with an external examination of Cora?
Yes.
And what did you observe during that external examination?
The external examination of Cora, I saw evidence of medical intervention. She was intubated, had various EKG pads and defibrillator pads on her body. She also had a catheter on her right hand and puncture sites on her left hand and her left groin. She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg. Her hands at the time of my external examination were covered by police evidence bags, and they were secured at the wrist with tape. When I removed those, the fingers showed no evidence of injury, and the fingernails were all of equal length and intact. And then I noted evidence of trauma of the neck with associated injuries of her head and minor injuries of her right arm and of her legs as well.
And in terms of the injuries that you observed, evidence of trauma to her neck, were there also injuries to her face and neck area that seemed to go along with the trauma to her neck?
Yes, there were findings with of the head that were associated with the trauma of the neck.
And what were those?
So on her neck, she had a ligature furrow. A ligature is an object used to apply external force to the neck or compress the neck, and a furrow is simply the pattern of injury that develops underneath the site of compression. So for Cora, her ligature furrow consisted of a linear, horizontally oriented area of pallor or paleness around her neck with distinct superior and inferior edges. On the front part of her neck, the lower half of the ligature furrow was associated with additional red abrasions ranging from 1 to 2 millimeters in size. And on the back of her neck, the superior and inferior edges of the ligature furrow had developed some linear bruising as well.
And what do you mean by a furrow?
So again, the furrow a ligature is when you have external compression by an object on the neck, and a furrow is simply a pattern of injury that occurs beneath it. It can be an imprint, it could be a pattern, or it could be more developed types of injuries such as bruising or abrasions.
And what about injuries?
All right, Counsel, we're going to take a break this time, all right?
All right. Jurors, close your notebooks. Place them on the chairs, please. This way, please.
Recess for a few minutes. I'm going to come back. We'll speak to counsel in regards to schedule. Okay.
You look at that moment, right? And then what is the takeaway here? How does the jury interpret this? A mother realizing the horror that she created and then holding her responsible for it? Do they look at this and say, I can't believe prosecutors are putting this mother through this again? And to me, this is a big deal because this is a case where the evidence, it's such a close call that if there is some sort of visceral emotional reaction from the jury, that could be the filter through which they see the rest of this case and how they interpret it. If there's a level of sympathy for Lindsay Clancy, that's a big, big problem for prosecutors because you feel sympathetic for someone. You're going to want to see if you can help them. And how can you help? Well, you help them by finding them not criminally responsible. But if the sympathies lie with the innocent children whose lives were taken and what they went through, you're going to want to hold someone responsible for that. And again, while this is a moment where the testimony is important, it is significant, right? In a murder case, the jury has to understand how and why these children died. But on the other hand, the breakdown of this defendant in her wheelchair with her two nurses running out to try to help her, if that garners sympathy for her, it could go a long way to this jury finding her not criminally responsible. That's it for this time. Obviously, our coverage of this trial continues. I'm Vinny Politan. Thank you so much for watching. In the meantime, please don't forget to hug the kids.
They were strangled, deliberately and meticulously killed by this defendant on January 24th of 2023. One by one, she wrapped exercise bands around each one of the kids' necks and pulled until their little bodies were limp and lifeless.
The prosecutors say Lindsay Clancy did it.
And he knew when he brought this charge that it was going to kill the soul of this young woman. And they would bring their evidence in front of a jury that she knows that she killed these children.
Her defense is saying she did it. The only real issue in dispute at Lindsay Clancy's triple murder trial is whether she should be held criminally responsible because of her mental illness. But a growing number of people don't agree with the prosecution or the defense. They're pointing the finger at Lindsay's now ex-husband, Patrick Clancy.
She said she heard a man's voice telling her that if she didn't do it now, she would lose her chance.
So what exactly is the evidence that is convincing people that everyone in the courtroom is getting it wrong? And could anyone on the jury also be looking at Patrick Clancy as a potential suspect? The triple murder trial of Lindsay Clancy is the biggest case in the nation. It's not supposed to be a whodunit, but there's a whole bunch of people online that are now pointing the finger at someone else, not Lindsay Clancy, but Patrick Clancy. So what exactly is the evidence that is convincing these people online that the government, the prosecution, and the defense have it wrong? I'm Vinnie Politan. Let's investigate. This case, this trial, has taken on a whole different life online, something that I wasn't expecting. I'll be honest with you, I was not expecting any of this, but it's for real. It's really happening. Lindsay Clancy, it's a mental illness defense that she's putting out. And it's not the first time I've covered one of these. And when the defense says mental illness, legal insanity, they are conceding the underlying conduct, that the client, the defendant, is responsible for what they're accused of. In a murder case, if you're claiming legal insanity, you are basically telling the court, the judge, the jury, the world, yes, I did it. I did it. But I shouldn't be held responsible because of my mental illness. It really wasn't me. And that's what's happening in this case with Lindsay Clancy. It's exactly what's happening. So everything else is happening online, to me, so unexpected. Now, Patrick Clancy is the one who's become the online target. And why is that? We're going to dig into that. And that's what this episode is all about. But when I think about where we are in the world of true crime, right? The true crime audience that is growing and growing and growing and taking a deeper look at these high profile cases, it's reaching a point that I don't think it's ever been in my career at Court TV. And you know, I've been here longer than anyone on earth. So the atmosphere is a little bit different. But this is different than the Karen Reed case, okay? The Karen Reed trial, where folks at home weren't believing what prosecutors were alleging, there was someone in court who believed the same thing that the online audience believed, which was that Karen Reed was not guilty, that something happened inside that house and someone else was responsible for what happened to John O'Keefe, and Karen Reed was not guilty. And in the end, the jury agreed with the sentiment of the folks who were following and watching and listening to every detail in the Karen Reed case. But as I said, this is different. This is different because no one inside this courtroom is pointing the finger at Patrick Clancy. No one has accused him of anything. He's not part of this defense case. He's a witness. He's a victim. So where is the evidence that the audience, that the viewers, that the true crime community is looking at that points them in this direction? Right? I mean, let's start here. What I did is on my YouTube page, I put up a poll, just trying to get a pulse of like, how big is this movement? How many people are thinking this? And take a look at the poll. And the question was simple. Do you believe Patrick Clancy is responsible? Boom. 21% saying yes. 79% saying no. All right. The 79% aren't saying that Lindsay Clancy necessarily is guilty, but Patrick Clancy isn't the one who took the lives of their 3 children. And that's kind of important, right? But 21% is not a negligible number. That's like a real number. So I wanted to dig deeper and understand exactly, well, what are the facts surrounding this belief? Because it can't just be one little thing. It has to be more than that. And I posted this thing on Facebook and got a response from Tony Ann, who gave a very detailed analysis of what folks are saying and why folks believe that Patrick Clancy is involved. And again, he hasn't been charged with anything, and no one is pointing the finger at him. None of the investigators, no one from the DA's office, no one from the defense team, whose job it is to do anything and everything to defend their client. So if someone else was responsible, or there was evidence that someone else was responsible, it would seem Kevin Reddington and his team would have to uncover that and would have to make those arguments, but they're not. So here's what Tony Ann said. And number one, his DNA is on the bands, not hers. The murder weapons, the exercise bands. That is the belief of folks online. He changed clothes from the CVS to the restaurant. Remember, when he leaves the house, he goes to CVS first, then goes to the restaurant to pick up the food, and then returns home. And the allegation is here that he goes to CVS, he's wearing clothes, one set of clothes there, and then somehow changes his clothes in between going from CVS to the restaurant. Her prescription bottles are in his car. He stated under oath that it takes 3 minutes to get to the CVS, yet he didn't enter it until 5:32. So his timeline doesn't make sense. Claims he sent a work email from the car, but also stated it was sent from his Surface Pro, which was in his home. Then stated under oath it could have been sent from his iPhone. Okay, did he send it from a Surface Pro? Did he send it from his iPhone? Is there a difference there? So is he lying about what he's doing in that time? Is he cleaning up the crime scene and he's not doing what he said he was doing? I guess those are part of the allegation here. Her Apple Watch was found in a drawer, yet it appears he has it on his hand when he's entering the CVS. And this is significant because there was a call while he's at CVS to Lindsay. Patrick and Lindsay are calling one another. And the Apple Watch plays a role in what people are talking about, because I've seen people say, well, he called himself on her Apple Watch, which he brought to the CVS. The crushed pills in the glass, he profited from this, $1.7 million from a GoFundMe, sold the house and made a profit from that as well. Remember Chris Watts. So you get an idea of the sentiment here. And Chris Watts was an absolute villain and a murderer. And he's in prison now for what he did. But the comparison of Patrick Clancy and Chris Watts, to me, that's a stretch. Like the level of evidence against Chris Watts was overwhelming. Overwhelming in that case. The evidence against Patrick Clancy, and this is what it is. So let's take a look at some of this and what we've seen inside the courtroom. And let's start with this wardrobe change. First, let's take a look at Patrick Clancy at CVS and see what we notice. Let's take a look. He's walking in. You want to notice his shoes and his jacket, because that's what people are talking about. And the shoes appear to be brown. He's walking around. He's got some sort of a jacket on, right? He's going down the aisle. And I guess the allegation is that when he makes the phone call, and this is interesting, look at the shoes. The shoes look basically brown from that video as he walks in. And again, here he is walking down the aisle. Is that where he makes this faux phone call, right? It would be a fake phone call on the Apple Watch. I couldn't tell from the video specifically about the Apple Watch, but let's now take a look at Patrick at the restaurant. We just saw him at CVS. Let's take a look at him at the restaurant now. All right, do the shoes appear a little bit lighter? Is it a different? He zips down his jacket now. And is he wearing an Apple Watch? I'm trying to understand that. It's hard with the sleeves. What I do notice, though, is his shoes are lighter, but they do look kind of brown right there. Maybe two-toned. The sole looks a little white, but his face looks much more pale here as well, as does everyone, including that other customer. Everything looks a little lighter, like the video itself is brighter. And again, we're looking at shoes, at jacket, and Do those appear to be different shoes? Like each frame, they look a little different. Watch the shoes. Depending upon the lighting, they appear, from my perspective, to sort of change a little bit if you take a look at them. Now, if you take a freeze frame, we got a freeze frame. We'll do that so you can do a side by side. Looking at this particular freeze frame, yeah, the shoes look different. But do they? If I look at his left foot on the left side of the screen from CVS, from that angle, there appears to be sort of like a two-tone thing going on in the shoe, right? The middle part is a little bit darker, and the outer part of the shoe is a little bit lighter, right? So the inner part here is a little darker, and this part is lighter. To me, that's consistent with what you see on the right, although everything is lighter on the right, including his face, which is almost washed out. But you look at his right leg looks like a boot, doesn't look like a sneaker or a gym shoe or a tennis shoe. And the soles look darker on the left than they do on the right. So what exactly does that mean? Did he change his shoes? Did he change his jacket? On the left, is that just a little, partial zipper, pullover, versus he fully unzips it when he gets to the restaurant? I'm not buying that. Maybe you are, but I don't see that much of a difference between the jacket. Like, could there be a zipper on the left-hand side that goes all the way down? Yeah, there could be, because the contrast in the video is such that you can't distinguish things. Like, look at his left arm. Like, what is that? It doesn't even look like a hand. It's because the lighting's not perfect and the camera's not as good as the camera I have here in my studio. But this is part of the basis of what folks are seeing. Let's move on to the fingerprints, because this is another issue, right? Fingerprints on the murder weapons, the knife, etc. Here's the testimony from the fingerprint examiner from the Massachusetts State Police. This is like his job, is to get fingerprints, is to get that sort of evidence from other pieces of evidence, to get the fingerprints to try to tie someone to the murder weapons and the knife. Let's take a listen.
When you touch an item and leave some remnants of a fingerprint, it's the oils and everything that are on your finger that leave the impression on the item.
Yes.
And so are there things that can affect whether you actually get enough information to analyze a fingerprint?
Yes.
What kinds of things can influence that?
So it could be the texture of the actual object itself. It could also be environmental factors. If there's low humidity, it could be if there's the person touching the item might not have residue on their hands. There's also movement can affect fingerprints. The strength, the grip on an item also affects that, as well as they could be wiped off, because fingerprints, like I said, are very, very, very fragile.
Okay, and so is it oftentimes the case that you analyze for a print and don't find anything of value?
Yes.
And so as it pertains to these items that you reviewed, the knife, the exercise bands, can you tell us what your findings were when it came to the knife?
Yes, the knife did have limited detail, meaning that there were areas of friction ridge impressions, which is that's what we've referred to fingerprints. Is the friction ridge skin is the skin that covers your palms and your fingers and your toes and your feet. The friction ridge skin is what leaves the impression on an object. So there was an area of friction ridge impression on that knife. Mm-hmm. So it was photographed further and giving an item number. Upon further analysis, there was not enough detail to do a comparison.
So when you photograph it for further analysis, why do you do that?
Do that in order to take a deeper look to see if there was enough characteristics or minutia to do a comparison to a known print.
So with a photograph, you can enhance it and look at it closer, correct?
Correct.
But after doing that, were you able to make any sort of opinions about that area on the knife?
Yes, there was not enough characteristics or minutia to do any comparison, so it was deemed no value.
And as far as the exercise bands, fair to say you also did the same and examined those to try to identify if they had any friction-rich detail or anything of value that you could conduct a comparison on, right?
Yes.
And was there any on either the yellow band, the black band, or the blue band?
No, there was not enough to do, no value.
Okay. So the case can't be solved with fingerprints. You couldn't. There was nothing there. Sometimes they get fingerprints, sometimes they don't. You know, before there was DNA, fingerprints were like the gold standard, right? You get a fingerprint, you can tie the defendant to the murder weapon, you can tie them to the scene. That doesn't exist here. But the other part of all of this is that it's their home and it's where they live. So even if you did find fingerprints on a knife or on an exercise, what would it mean? Like, it's in their house and they use it. So from my perspective, the fingerprints, not really a big deal, even if they did, but they weren't able to find anything either way. So here's when you look at the bigger picture of what we're talking about here, this is a case that's fully investigated by the Massachusetts State Police and the Duxbury Police and the DA's office. And they came up with nothing to point the finger at Patrick Clancy. What incentive would they have, right? And I said, it's different than Karen Reed. In Karen Reed, law enforcement was part of the alleged conspiracy in the case. So they had a reason why they wouldn't find evidence or would find evidence. But here, no one's got a dog in the race. Like, there's no reason to protect Patrick versus Lindsay or Lindsay versus Patrick. Although Kevin Reddington has one job and one job only, and that's to protect Lindsay. And wherever there is evidence that would point a jury in the direction of setting her free, he has an obligation to do that. Now, I think the skepticism of viewers is healthy. And I think jurors should have that same skepticism when it comes to the evidence and trying to figure out what happened. And I think Tony Ann, in her comment, provided a lot of that. The first line, though, she talked about was, his DNA is on the bands, not hers. So I want to dive into that issue and take a listen to some of the DNA evidence. We begin with the blue exercise band, which was used to take the life of little baby Callan. Here's the judge talking about the stipulation, what both sides, prosecution and defense, agree to.
The parties agreed to the following conclusions regarding comparison analysis of these items. A, item 2-4.1.1, sample from the ends of the blue exercise band. The DNA profile was interpreted as a mixture of 3 contributors. There are 5 individuals who have a likelihood ratio that indicates an inclusion in the profile. They are Dawson Clancy, Callan Clancy, Cora Clancy, Lindsay Clancy, and Patrick Clancy. B, item 2-4.2.1, sample from the middle of the blue exercise band. The DNA profile was interpreted as a mixture of 3 contributors. Callan Clancy is included as a major contributor. And C, item 3-3.1, sample of swabs from the red-brown stain A on the basement floor. The DNA profile was interpreted as originating from a single contributor. Cora Clancy is included as a contributor to this DNA profile. So that's the stipulation that the parties have agreed to. All right.
And here's the difficulty with DNA in this case, is that family members' DNA is mixed together. So sometimes you can't tell if there's 2 people who are contributing to the DNA, 3, 4, or 5. And what you just heard from the stipulation is both sides agree that Lindsay had an equal likelihood of inclusion in the profile. So she could have been there. They just don't know because family members have common DNA. It could have been Patrick. It could have been Lindsay. It could have been both of them. That's what that stipulation just told us. Let's move on to the yellow exercise band, the one that was used to take the life of Dawson. Here's the criminalist, Katrina Stashin, testifying.
For item 2-2.1.1, sample from ends of yellow exercise band located in basement office. The DNA profile is a mixture, including male DNA. Due to the possible relatedness of low-level contributors to this profile, an alternate number of contributors was considered. First, assuming 2 contributors. The DNA profile is a mixture of at least 2 contributors, including male DNA. Contributors 1 and 2 are suitable for comparison. The DNA profile was interpreted as a mixture of 2 contributors. The DNA profile from this item is at least 1.7 nonillion times more likely if it originated from Dawson Clancy and an unknown individual than if it originated from 2 unknown unrelated individuals. This provides support that Dawson Clancy is included as a contributor to this DNA profile. Cora Clancy, Callan Clancy, Patrick Clancy, and Lindsay Clancy are excluded from this DNA profile. Assuming 3 contributors. The DNA profile was interpreted as a mixture of 3 contributors. Contributor 1 is suitable for comparison. Due to limited information and possible relatedness of contributors, contributors 2 and 3 are not suitable for comparison. The DNA profile from this item is at least 920 octillion times more likely if it originated from Dawson Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides support that Dawson Clancy is included to this DNA profile. Cora Clancy, Callan Clancy, Patrick Clancy, and Lindsay Clancy are excluded from contributor 1 of this DNA profile.
And then going to item 2-2.2.1, the swabs from the middle of the exercise band, what were your findings for that?
The DNA profile was interpreted as a mixture of 2 contributors, including male DNA. The DNA profile from this item is at least 1.5 nonillion times more likely if it originated from Dawson Clancy and an unknown individual than if it originated from 2 unknown unrelated individuals. This provides support that Dawson Clancy is included as a contributor to this DNA profile. The DNA profile from this item is at least 3.6 million times more likely if it originated from Callan Clancy and an unknown individual than if it originated from 2 unknown unrelated individuals. This provides support that Callan Clancy is included as a contributor to this profile. The DNA profile from this item is at least 1.4 billion times more likely if it originated from Patrick Clancy and an unknown individual than if it originated from 2 unknown unrelated individuals. This provides support that Patrick Clancy is included as a contributor to this DNA profile. Cora Clancy and Lindsay Clancy are excluded from this DNA profile. The mixture DNA profile from this item is consistent with having originated from 2 individuals. There are 3 individuals who have a likelihood ratio that indicates an inclusion. Though there is support for the individual inclusions of Dawson Clancy, Callan Clancy, and Patrick Clancy to the mixture DNA profile, under the stated assumptions, these individuals cannot be present in the mixture together. Assuming 1, 2 contributors, and 2, Dawson Clancy is one of the contributors, Callan Clancy and Patrick Clancy cannot be present in the mixture together. Support for inclusion may be impacted by mixtures which contain relative, especially first-degree relatives. Refer to the independent inclusionary statistics above.
That's the clip I think a lot of people are focusing on, right? This is the yellow exercise band where they're excluding the 2 female members of the family from the sample that they were able to get, right? Cora and Lindsay are excluded from that. They're the females, but the males are included. It's two of them, making the presumption that there are 2 or 3 contributors. The confusion here is that they're taking various samples from it and making presumptions that, okay, because it's family members, if it's 2 people, then it could be this person, this person, this person, or this person, but not all 3. And that's what they're talking about there. But that's the one example that I think has really become the genesis of the DNA argument in this case. But it wasn't the case with the blue exercise band. Okay, let's take a look now at what was said about the black exercise band, the one that took the life of Cora, the daughter.
And then going to item 2-3.1.1, the swabs from the ends of the black exercise band, you found that that sample was a mixture but wasn't suitable for comparison, correct?
Correct.
And what does it mean to be not suitable for comparison?
I'll read the statement in the report and then I'll clarify as needed. The DNA profile is a mixture, including male DNA, and is not suitable for comparison due to the complexity of the profile, the possibility of at least 5 contributors, and the relatedness of potential contributors.
And then going to item 2-3.2.1, the swabs from the middle of the exercise band, what were your findings there?
The DNA profile was interpreted as a mixture of 3 contributors, including male DNA. The DNA profile from this item is at least 870 trillion times more likely if it originated from Dawson Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides support that Dawson Clancy is included as a contributor to this DNA profile. The DNA profile from this item is at least 1.6 nonillion times more likely if it originated from Cora Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides support that Cora Clancy is included as a contributor to this DNA profile. The DNA profile from this item is at least 2,600 times more likely if it originated from Callan Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides support that Callan Clancy is included as a contributor to this DNA profile. The DNA profile from this item is at least 220,000 times more likely if it originated from Patrick Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides support that Patrick Clancy is included as a contributor to this DNA profile. The DNA profile from this item is at least 11 times more likely if it originated from Lindsay Clancy and 2 unknown individuals than if it originated from 3 unknown unrelated individuals. This provides limited support that Lindsay Clancy is included as a contributor to this DNA profile. The Massachusetts State Police Crime Lab DNA Unit validation studies showed inclusions for known non-contributors in the likelihood ratio range of at least 2 to 1,000 adventitious support could be attributed to this conclusion. The mixture DNA profile from this item is consistent with having originated from 3 individuals. There are 5 individuals who have a likelihood ratio that indicate an inclusion. Though there is support for the individual inclusions of Dawson Clancy, Cora Clancy, Callan Clancy, Patrick Clancy, and Lindsay Clancy to the mixture DNA profile, under the stated assumptions, these individuals cannot be present in the mixture together. Assuming 1, 3 contributors, and 2, Cora Clancy is one of the contributors, Dawson Clancy, Callan Clancy, Patrick Clancy, and Lindsay Clancy cannot be present in the mixture together. Support for inclusion may be impacted by mixtures which contain relatives, especially first-degree relatives. Refer to the independent inclusionary statistics above.
For this item, the middle of the black exercise band, the highest number of possible inclusion was the 1.6 nonillion times more likely if it originated from Cora Clancy and 2 unknown individuals, correct?
Yes, the highest statistic for this item was a likelihood ratio of 1.6 nonillion for Cora Clancy.
And based on your analysis of the data that you had, you determined it was a mixture of 3 contributors, correct?
Correct.
And so when you have the 3 contributors and Cora Clancy has the highest likelihood of being a contributor, if you include her in the mixture, the other 4 members of the family are excluded, correct?
Assuming 1, 3 contributors, and 2, Cora Clancy is one of the contributors, Dawson Clancy, Callan Clancy, Patrick Clancy, and Lindsay Clancy cannot be present in the mixture together. Again, those statistics are all calculated independently and don't say anything about those people being in the mixture together.
Okay, the bottom line, they're not eliminating Lindsay Clancy from this black exercise band. There's a possibility of 5 contributors in 2 different samples that they got. And another one, it's 11 times more likely. Like the numbers aren't as high as Patrick's, but the numbers are there. She's not eliminated from this. And again, the complication comes because it's familial DNA being mixed together, and it's hard to distinguish how many people's DNA is even there. And by the way, why would Patrick Clancy's DNA be on there? He testified that when he went to the basement, he removed the exercise bands from his 3 children. So yeah, his DNA should be there. Her DNA, yeah, it is not eliminated from being there. So on that issue, I think the focus really ended up on that one sample from one of the 3 bands. So another one of the issues I wanted to talk about when it comes to people who are questioning whether or not Patrick Clancy is involved in all of this is his conversation with Lindsay when he came home from picking up the food and going to CVS. Let's put this up on the screen. This is a comment from my social media from Diane, who said, I read that the first responders / paramedics said she couldn't talk. How did she answer they're in the basement to her husband? Right? So on the one hand, Patrick Clancy is saying he's having a conversation with Lindsay, and folks are like, but didn't the EMT say she couldn't talk? So let's take a listen now to Patrick Clancy talking about this moment.
And when you saw Lindsay on the ground there under the window, which direction was her body facing?
Her head was closer to the house. Her feet were away from the house.
Okay. And did you go to her?
Yeah.
And did you observe any injuries?
Yes.
And what did you see?
She had deep cuts on her wrists, and she had a red line across her neck. I wasn't sure what it was at first, but she cut her neck.
And do you recall that these wounds weren't actively bleeding at the time?
I later learned that I said that on the 911 call.
And when you observed these wounds, is it correct that the 911 operator asked you or instructed you to apply pressure if needed?
I don't recall the whole call, but I believe that's probably true.
Okay. And you didn't at the time feel the need to apply pressure to any of those wounds, correct?
Correct.
Did you say anything to Lindsay when you found her in that state?
Yeah, I said, what happened?
And what was her response?
She said, I tried to kill myself.
Did you ask her anything else?
I said, where are the kids?
And what was her response?
She said, they're in the basement.
Okay, that's pretty clear. That's pretty straightforward, right? Now, I want you to take a listen to Stephen Hall from the Duxbury Police Department, one of the first responders to the scene, and his observations of Lindsay Clancy.
Was she conscious?
Semi-conscious, in and out of consciousness.
And what was she doing that gave you that indication?
She would wake up and move around and then kind of just go still again.
And when you say she would move around, what parts of her body was she moving?
Just her head, really.
Was she able to speak to you?
She wasn't, no.
Was she making any sounds?
She was just, like, it sounded like she was in pain.
So something like moaning or something like that?
Yes.
So this obviously fueling a lot of the sentiment that, wait a minute, how could this be true? Like, what is going on here? How could she speak to Patrick Clancy but not speak with emergency responders? I want to bring in a special guest to help us work through this issue and some other things that are happening up in Plymouth, Massachusetts. Bob Motta joining us. He's the host of the Defense Diaries podcast. Make sure you check it out. The other great thing right now, Bob, you can see he's got water behind him. He's in Massachusetts. He's been inside the courtroom. Bob, great to see you.
Great to be here, Vin. Always love to hang with you, my friend.
Yeah, first tell people where you are so they believe me that you're in Massachusetts.
I am, I've been lucky enough to secure room and board in a fabulous beach house in Hull, Massachusetts. So we're right on the beach, and it's, as you can see, pretty beautiful out. It's a nice way to kind of cleanse from the trial. At the end
Absolutely.
of the day. Yeah.
Absolutely. I want to get your comment on what we just saw. What's your interpretation of why Patrick Clancy could speak with Lindsay, but the EMTs could not?
I don't know. I don't know how long it took the EMTs to get there after the 911 call. I don't know if the EMTs were trying to engage her in conversation, like if they were asking like what happened, and like that wasn't one of the questions that got asked. Like, did you try to speak to her? The question that was asked is, was she speaking? So I look. Here's where I'm at with the Patrick Clancy thing. I'm just gonna say it like right out. I'm friendly with Kevin Reddington. Kevin Reddington has, since the inception of this case, has gone to the Commonwealth and said, look, we'll stipulate to the homicides. My client did it. My client has done this. He offered to stipulate right before the trial started again, and it's been a continuing thing. I have to trust that Kevin Reddington, who has been representing her since the minute this happened, has asked all those questions. The guy's a war horse. The guy's been doing it for 50 years. I've got all the faith in the world that if Patrick Clancy was a potential suspect in this, that Kevin Reddington would have jumped all over it. And, we are where we are with it. So I can't answer those questions because I don't know the answers. I don't know.
Let's talk about this, though. Like, you are a trial attorney. I've been covering the highest profile trials in the nation for decades now.
Yeah.
There's something happening, though, because the public is reacting this way, right? From my perspective, I'm looking at this and I'm saying, well, wait a minute, true crime is blowing up. And there are people now coming into the world that we've been living in for decades, and some are seeing it for the first time, but some are taking a much deeper dive than they ever did before. Moments like this, and we're talking generally now, like little facts that don't seem to add up. I've said before, I see it in like almost every trial. There are things that don't, you really, like something else is going on here. I can't fully understand it.
Right.
Is it unusual that these types of things are cropping up during this trial?
I don't think so. It's like you said, every trial has those kind of like odd facts that make you kind of tilt your head and go, and like that's where reasonable doubt lives, though. You know what I mean? There is, because we're always, as attorneys, Vin, we're coming in after the fact. Law enforcement's coming in after the fact. We're trying to recreate a situation that's occurred through witness statements, if there's video that's available from the evidence that they find on the scene, and you're trying to put this puzzle together. Granted, I will admit that I don't think that would be a conversation that Patrick Clancy would forget in terms of that moment in time. So, if there were a doctor to come on and say, because I've seen some of the videos, I saw an EMT say, look, her spine was crushed, her thyroid was crushed, there's no way she could make words. It's a strange fact. It's a strange fact if you're trying to figure out, like, why would he make that up? Even if you don't go to it's nefarious, like that he was the guy who somehow did it and somehow Lindsay Clancy has forgotten about it. You know what I mean? Or it's that part of it for me is strange. All of the rest of it, not so strange from what I've heard of the theory, But again, in that moment in time, I don't know if she can make words or not. I'd love to be able to ask her. The woman can speak. She's got it. She doesn't have amnesia.
Right.
That's what I'm saying. Like, I have to lean on trusting Kevin Reddington that if anything regarding the ability to be able to try to pin it on Patrick existed in the world, that guy would have figured it out immediately and vetted it. You know what I'm saying? It's like you have to trust a guy who's been, on the super lawyers list for 20 years straight, and who's an absolute. I mean, you're watching him. It's like watching
I've been watching Kevin
Matlock.
Reddington for decades on court TV, for goodness sake.
Right.
I've seen him try other cases in person when I was a correspondent. Let me ask you this, from a defense attorney's perspective, which you are.
Yep.
Would it be unethical to claim what he's claiming, which is really legal insanity, but I know Massachusetts uses different words for it. But would it be unethical to claim legal insanity, meaning you're conceding that your client did it, if your client did not do it?
If he knew? Yes.
Right.
Why would he do that? If he
maybe
had
it's a better defense. Like, even if it's let me just throw this out there, right? So let's look at the two potential defenses, right, that the audience is talking about.
I love this
the viewers
exercise.
Are talking about, which is the lack of criminal responsibility, the legal insanity, versus somebody else did it, and it's Patrick, right?
Yeah.
If those are the two defenses, like, we're watching this trial, we know which one is stronger. But what if the one that looks stronger isn't the truth?
How does it, man? The abuse that I'm taking online because I've taken the position that I believe
all
that
of us are. All
right.
Of us are.
Oh no, I tweeted a couple of, like, during the debacle day when Lindsay was just in, and I'm 10 feet away from her watching this. I'm 8 feet away from her parents who are sitting right behind her, and this woman is a puddle. She's destroyed while they're going through the autopsies, and the people that are eye for an eye are like, good. You killed your kids. I don't care if you had psychosis. I don't care what your mental, those folks exist in the world. That's always the challenge with a not guilty by reason of insanity, what it's traditionally called. Those folks don't care, if he like, to me, what is easier? Like, we call insanity defenses the defense of last resort because of that thing that I was just talking about. There are people that you will never convince that if you've done acts like this horrific, the unthinkable, killing your own children, that there is no way in the world that anybody that thinks that way is letting her slide. They don't care. They're like, even if they prove that she was psychotic and they don't really understand what psychosis is, and then they come to learn what it is through experts, they can't do it. They can't bring themselves. She has to pay for what she did. I don't care what her mental state was. So you have those folks. So it makes it an incredibly difficult, because it's really a reverse jury nullification. Because if the Commonwealth, who has to prove it beyond a reasonable doubt that she did not have psychosis, which is hard, not like,
it's very difficult.
It's very difficult because you're you're really kind of like having to look at all the totality of the circumstances and trying to put this puzzle together, and like, which is why they're attacking with the planning. But people are going to come to find out that you have moments of lucidity. Psychosis can wax and wane. You can do complex tasks. You can manipulate a knob at a museum. You can put on a face and, make a conversation if you're, in and out of psychosis. So for me, if Reddington knew that there was a possibility that Patrick had done this, and let's all understand, he's got all the discovery. He's got everything. He's seen it all. And if he would have thought that there was any way possible that he could have pointed the finger at Patrick, that's a way easier case than trying to get to land, an insanity defense with the jury. It's so hard to do, man. It's so hard to do. I think this case is going to live in perpetual mistrial land. I just do. I think there's going to be.
It's interesting. You say that. I always look at that as like the cop-out analysis in most cases.
Yeah.
But not in this one. Not at all. Let me ask you this, though, because I want to get back to this Clancy issue. What I've seen, and I think what we've seen together, is that when you listen to the folks who are watching the trials, right, and you get a sense of where the audience is, I've noticed that there's a consistency with what the audience is seeing and what the jury is seeing. My numbers from my own audience is like, we're over 20% of the people think that Patrick is responsible. Do you think that could seep into the jury room, even though neither side is arguing it, neither side is alleging it, no one is going to say or point the finger at him. Do you think there's one or two jurors, that 20%, that could think that and could be a problem for prosecutors here?
I think that could be an issue, but not in the sense that I think that the jury's going to kind of put the pieces together just because what they've seen and what they haven't seen. And you know, they're not having the ability to be able to do the deep dive online when they go home at night. At least they're not supposed to be. You know, whether or not jurors actually do that when they're not sequestered.
I trust them.
Yeah, I do. I do too. You know, kind of. I don't know how you stay off your device for a month. And if you're on your device, I don't know how if you live in this area with geolocation and geo mapping and all that stuff and the geo fencing, like you're going to run into it because the content's just going to drop in on your phone. So unless you're avoiding social media, I don't know how they're not. So the potential exists, but where I think that it's going to get tough, the thing that I'm seeing a lot is, let's say that the defense that Reddington puts on is very compelling, that his experts explain psychosis in a way that it kind of resonates with people. And people will start asking the question, well, how didn't Patrick know? And why would Patrick have left her alone with the kids? And that's kind of the thing where I'm seeing a lot of comments like that, where the kind of it's a little bit of blame shifting over to Patrick because he put her in a position to be able to do it where he should have known that she was so far off that it would have been impossible for him not to be aware of it. You know, so I think that could be a thing that could pop up with them, you know, but in terms of kind of putting these little pieces together, like, are they going to remember, you know, because it was a moment, right? Like that moment in the courtroom where you're sitting in that courtroom and you're watching the father of these children on the stand and the jury's just sitting there, you know, paying rapt attention, and he's describing the moment that he comes upon her. They're lost in that moment. And then when they follow that up with the 911 call, you know, I mean, like I don't even know that their head's going there because they're feeling sympathy for him just naturally, you know, as the father. So like, are they going to be able to say, did they take copious notes and say, oh, well, wait, he said she said something, but 3 witnesses later, one of the first responders is saying that she couldn't make words. You know, is it possible that somebody puts that together? Sure. You know, but is it going to be a thing where I think that there's going to be enough people in that jury to be like, because they're just not getting all the other theories that are kind of out there.
And the lawyers, and neither side, obviously, no one's going to be arguing that. And that's usually, you know, kind of like the roadmap for the jury going in there. Bob Motta, I know you're super, super busy, and this is like some time off that you're having from covering all this, but we really do appreciate it. I hope you enjoy that water behind you over the weekend, and we'll speak soon.
Love it. It's always great to hang, Vin.
That's it for now. I'm Vinny Politan. Thank you so much for watching. Of course, our coverage of this case and this trial will continue here on VPI and on Court TV and Court TV's YouTube channel with live streaming of every moment, every minute of testimony and evidence in the case. We'll see you next time. In the meantime, please don't forget to hug the kids.